Tuesday, July 28th. It's at 6:04 right now. We're having our remote meeting, and this meeting is being recorded. We're meeting via Zoom. I'd like to call the meeting to order. And the first item of business, number B, is interview and appointment of Reserve Officer John Clifford to full-time police officer status. Do I have a motion?
Yes, Madam Chair. I move that the Board of Selectmen appoint John Clifford as a full-time police officer effective September 13th, 2020.
Second. I have a second. Discussion. Chief Horvath, would you like to speak?
Hi, good evening, everyone. Thank you for taking the time to allow us to sit before you tonight. So this is for Mr. John Clifford, an interview for a full-time police officer position with our department. John's been with our department since May of 2017 as a reserve police officer. During that period of time, he's demonstrated himself to be very steady, reliable, and always willing to step forward for our department. In addition to that, in March of 2019, he started working for us in a full-time capacity as a civilian dispatcher. And he brought a tremendous amount of support to our department in that position. We're very thankful for that. He's recently taken on a medical coordinator position responsibilities for our department, which is really very important for us. And, you know, if I was going to describe John, as I said, steady, reliable, always there, very rarely ever says no to anything we ask him to do. And he's a gentleman, which to me is very important in this job, is to be a gentleman and have compassion. And Mr. Clifford has that. So he's here this evening. He's got a suit on, at least from the waist up, from what I can tell. And he's here and happy to answer any questions you may have.
Thank you, Chief.
Welcome, John. Would you like to tell us a little bit about yourself?
So I grew up in Quincy, recently moved to Swampscott. I've been working in Rockport for a little over 3 years now as a civilian dispatcher, like Chief Horvath said. I really enjoyed working in Rockport. It's a small community, so you get to know everyone pretty intimately. And being a smaller department, you get to take on a lot of other responsibilities like the medical coordinator job and everything. So it's been a lot of great experience so far.
Great. Welcome. Board, any questions?
Yes, Madam Chair. Again, thank you, John, for all your efforts during the last 3 years and so forth. What are you looking forward to most being a full-time police officer?
Just being able to build on the training that I already have, going to the full-time academy, any specialized training that I could pick up throughout the years, and just kind of build on that and promote within the in the department.
Well, that's wonderful. Well, I wish you well.
Thank you.
Selectman Campbell.
Yes, thank you. John, again, thank you and welcome. And we're very, very happy and fortunate to have officers of your caliber coming along. I have a couple of questions. Number one is, I'd like to hear a little bit more about the medical coordinator position. That sounds interesting and intriguing. And I'll wait for the second question until you answer that one. So what do you think about that?
It seems like a very interesting position. I took an EMT course a couple of years ago, so I have a little bit of a medical background. I always like the education and training aspect of that. With the medical coordinator job, you're tasked with being a first responder and CPR instructor. So I'd be instructing other members of the department in how to perform CPR and renewing their certifications. Also tasked with ordering medical equipment, whatever we carry in the cruisers, getting the AED serviced, oxygen tanks, everything that kind of comes with that.
Fantastic. And my second question is, in light of today's climate around police and police activities, how do you view the role of a police officer in a community like Rockport, and what can you do to enhance and make that image what it should be and what we know it is? I'd be interested to hear your thoughts on that.
Well, Rockport's a fairly easy community to work in. I mean, we have a great support from the town and everything, and that certainly makes it a lot easier to be able to come in and do our jobs. I would say just keep doing what we're doing. We're always out and about saying hi to everyone, being nice, respectful. I think that's the biggest thing we can do.
Great. Thank you, John, and welcome aboard. I'm not official yet, but I don't think we're going to have many problems here. We'll see how it goes.
Thank you.
Sarah or Rob?
Sure, I
All
will
set.
just say, I would just, echo what everyone else has said and thank John for his service so far. I know the chief has been really happy with it. And, welcome aboard, even more full-time than you already are. But I love when officers start out here, in a limited capacity and kind of work their way up and love it and want to stay, and look forward to you working here for decades.
Thank you.
And Ross, any comments?
I'll second what everyone said, and I appreciate you choosing Rockport.
Thank you.
And I too, John, congratulations and welcome to the full-time job.
Thank you. Thank you.
So we've heard the motion, we've had a second, we've had discussion. Roll call vote. Selectman Campbell,
Aye.
Selectman Wilkinson,
Aye.
Selectman Murphy,
He said it.
Selectman Brackett,
Aye.
Okay. and Selectman George, aye, 5-0.
Yay,
Welcome.
congratulations.
Thank you.
Congratulations, John.
Welcome aboard, John. Glad to have you.
Thank you. Thank you. I appreciate it. Glad to be
Now get that suit off, it's too hot.
here. Thank you.
Thanks,
Everybody
Chief.
has shorts on below it instead of just a jacket up top.
Oh, no, I put on the full thing.
All right.
Good man.
All right. Thank you all very much. I
Thanks.
appreciate
Have a
it.
good night.
Thanks, John.
Thank you. You too.
Thank you, Chief.
Thank you, everybody.
Thank you.
Thanks, Chief.
Okay, next is, I'll turn it over to Bruce Cohen for Board of Health.
Great. Leslie and John, do you want to take us through this application, please?
Give me 1 second to find John Judd. There we go. John, just accept the unmute.
Okay, thank you very much, members of the board, Mr. Chairman. For the record, John Judd, engineer with Gateway Consultants. This is a replacement system, sewage disposal system at 15 through 17 Briarstone Road. This is at the end of the road at Briarstone, and there are actually three separate dwellings on this one property. And this is a replacement system to address Title V. And we are looking for relief on the proposed setback to one of the tanks to the coastal bank, so we can get the effluent outside the buffer zone as shown on the plan. So this is basically a relief for a tank distance to the coastal bank to the proposed pump chamber. And we do have two other requests, one of which is the perk test waiver and new textural analysis. And the final request for variant, the one test pit within the sewage disposal area. And I can answer any questions you might have.
Leslie, any comments before I open it up to the rest of the board?
I think the plan is very good.
Okay. Questions from Board of Health members? Sid?
Yeah, John, you said this is for 15 to 17 Briarstone, and you talked about 3 dwellings. Is this a septic system upgrade for one of those dwellings, or will there be multiple dwellings on that septic system?
All 3 dwellings, Doctor, are going to be serviced by this. So we're taking away a system, we're abandoning a system that's very close to the coastal bank for what is shown as number 15. That was the house that burned down a few years ago. And that we're moving everything back much further away from the coastal bank. We're going to have proper treatment. So this is a pre-existing situation where there are 3 separate dwellings on the property, and we're not increasing the bedrooms, but it is a combined system for all 3 buildings on that one lot.
Was it a combined system before?
No, there were 2 separate systems, both of which were in failure.
I bring this up because the board has not approved multiple dwellings on a single system, save for Old Farm Inn some years ago. Who is going to respond? Will these be separate ownerships? Who's going to be responsible for the maintenance? How is this going to be handled? Again, this is a unique and potentially precedent-setting circumstance?
Okay, so it's owned by the Hochberg family. They have no intention of selling. There are several sisters that own the property, the Hochbergs, and they will continue to own it. And they're renovating the house that burned down. They're going to keep it in their ownership. And in terms of the environmental impact, it's obviously an improvement where there is breakout from the upper system onto the Briarstone Road during the springtime months. So it's a pre-existing situation that's going to be improved in terms of the Title V aspects.
Sid, do you think in a situation like this where we're talking about multiple dwellings, you need to designate one of the owners as the primary responsible person for issues so we don't get involved in any kind of back and forth?
Well, I think there's all kinds of ramifications, Bruce, including what's to prevent any other group of people, related or not related, with a promise they will never sell until the septic system is in place and approved, to not want to have similar multiple dwellings on a single unit. Again, we've never had that before.
Dr. Wedmore, this is Leslie Whalen. This is one property. So Title V considers this to be one facility and actually prefers that all of the flow goes to one septic system.
So is this a condo situation where there's just different ownerships but one dwelling?
If there's one single ownership, there's one single ownership entity, and they happen to have 3 dwelling units on one property.
Well, that's all fine and good, but I'd like to see that continue in perpetuity with a deed restriction. If you are going to approve this and it's 3 dwellings owned by one group of people, otherwise, tomorrow or the next day or a time in the future, the board is going to be trying to figure out who's now responsible for this division of one septic system into 3 owners. So a deed restriction might be in order.
Title V would say that if they separated ownership, that then this would be considered a shared septic system, which technically it is not. If they separated and made separate lots or condoized it, then there's 2 possibilities. So there's a whole rule on condos. They would follow those if they condoized the property. If they separated into separate lots, and that seems unlikely given the size of the lot, but if they were able to do that, then it would be considered a shared septic system, and Title V has rules for that. So I think Title V has us covered. I understand your concerns, but this is a scenario where what's being proposed is what is actually considered the best solution under Title V.
If I could just, Doctor, if I could just expand on that. 2 of the dwellings currently are on one system, and the lower house is on its own system. So we currently have a situation where the two of the dwellings are on one failed system, which we're going to, obviously upgrade.
Is it physically impossible to design a system for each of these?
Title V actually would prefer that you don't. Title V prefers that what is happening here is what is done.
Title V may prefer, Leslie, but in the future, when you set a precedent, you are stuck with that precedent and cannot cut it off, change it, or be capricious and arbitrary once you set a precedent.
Sid, I think you raised some good points about multiple dwellings on one property and combined septic system. And I think as we move forward, we might encounter other situations that might be pushing the limits more than this particular situation seems to be. So I really appreciate your experience and perspective on this. But I think I'm comfortable with the current situation. In future situations, we're going to have to evaluate on a case-by-case basis whether deed restrictions or other kinds of solutions would be required. Ron?
Yeah, if I can just ask, I mean, this seems like a very good solution for the current situation. But if, just for argument's sake, one of these dwellings was sold, leaving the other two as part of, one property, what would happen? Would all three homes, even though they have separate ownership, continue on the system, and it would be some sort of a communally run, and all owners would be responsible for it? And if it were to fail, who would be responsible? That's the thing I'm a little hung up on.
Sure. If I could take that one. So what would happen if they were to deed out one of these dwellings, they would have to set up a condominium. Within any condominium, there's a maintenance requirement, homeowners association, et cetera, that requires monthly dues and so forth. Say the road has to be fixed, the driveway, that is, say the water service breaks, that has to be done. Any exterior improvements, that all goes into the homeowners association for the condominium. And as well as this just happens to be an on-site sewage disposal system. If it had a connection to town sewer, if the sewer pipe broke for the 3 condominiums, just like any other condominium in this town, it would have an association to have a sort of a kitty to take care of those issues as they arise.
So the homeowners association would be legally responsible for maintenance of the system. If any one of the properties was sold, it would require turning them into condos.
Absolutely. You couldn't deed this out without doing a condominium, or as Leslie said, if they did a special exception before the Zoning Board of Appeals, which again, there's no intent. The Hochbergs want to keep this property, but Dr. Wedmore is spot on. In the future, who knows? It could be tomorrow. It could be in 10 years. So it's absolutely, but it was always a potential. Whether you had this new updated, environmentally friendly septic system or the failed system that was before it. Nothing's changed except we're fixing something that was deleterious to the environment.
Barb, Mary Beth, any questions, comments?
I'm just really trying to think of another multi-unit that has a septic system in Rockport.
You go down on Eden Road, all the condominiums, those houses that were down on Eden Road.
Rocky Shores?
I believe it's Rocky Shores. That was all put on one common, or I shouldn't say one, I think there might be 2, but there's several cottages on that one. That's just one just to name one. There's several others in town too.
So we have done this before.
Yeah.
Did we do that before, or was it that Rocky Shores had a septic system that was supplying all of those rooms, and was a new system put in with the agreement of the Board of Health? I don't recall that the new system was put in, was it?
It's a septic system there. It's a condoized septic system.
And it was upgraded, I believe, in the late 90s. There's actually, I believe, 2 systems there, 2 different disposal areas.
So do I hear a motion to approve is there any more discussion? Sorry.
Well, I was just going to say that it sounds as if this is, from a public health standpoint, this is a sound proposal. So the question is, I mean, the other issues are a little bit beyond public health. So I don't know if there are any other committees that would need to look at this. But from a public health perspective, from what Leslie's saying, especially with respect to Title V, it sounds like it's something that's worthy of approval from that perspective.
So do I hear a motion to approve this plan as described by John Judd?
I move that we adopt the plan.
Second?
I'll second it.
Okay. Barb, vote.
Yes.
Sid,
Yes.
Ron,
Yes.
Mary Beth,
Yes.
and I vote aye as well. Thank you. And thank you, Sid, for introducing the discussion, which I think may become very important when we have future applications in front of our board. It's something that we really need to keep our eyes on.
Yeah.
Okay, thank you all very much.
Thank you.
Ruth,
Okay.
I'll turn it back to you for item D.
Item D, entertainment license hearing, Yankee Clifford Inn, 127 Granite Street. I'd like to read the notice that was in the paper. Town of Rockport Board of Selectmen public hearing, Tuesday, July 28th, 2020 at 6:15 p.m. to discuss the application for an entertainment license for outdoor music on the premises of Yankee Clifford Inn, 127 Granite Street, Board of Selectmen, Ruth C. George, Chair. It was in the Gloucester Daily Times, July 24th, 2020. Do I have a motion?
I do, Madam Chair. I move that the Board of Selectmen open a public hearing on the application of the Yankee Clifford Inn for an entertainment license to allow outdoor music on premise and outdoor PA system.
Do I have a second?
I'll
Second.
Thank you. Discussion. I believe we have Mike Barnhart for the Yankee Clipper on the call.
Yep.
Yes, I am here. I am here.
Okay,
Good evening, Selectmen. It's been, we've had a lot of changes due to COVID, and there are not a lot of events really on my agenda at this point. But I do have a couple weddings and like a rehearsal dinner, and that's about it for the season at this point. It's going to be very scaled down. One event, we're talking about a single DJ. The other event is probably just going to be an outdoor, like little Bose speaker. And the third event might not even happen in December based on what happens in the future. I'm sorry, I'm Mike Barnhart. I'm the general manager of the inn. I'm in my 9th season here at the inn. And as I said, the application was filled out quite a while ago, but obviously due to events, we weren't able to get that approved until hopefully tonight.
okay. Any comments from the board?
I have one. Will there be any in these potential events, any dancing?
No, we're not allowed to have a dance floor based on the state information. The average age of the first event that I'm specifically trying to get approved for tonight, the average age of the guest is in the 55 to 60-year-old range. So we're not talking about a speaker that's going to be thumping a lot of bass or anything like that either.
Yeah.
Let me just ask, Mike, what is the date of this one?
The first event is August 15th.
Yeah.
And it's 2 Rockport residents getting married.
Yeah. And the hours?
I'm sorry?
What are the hours of the event?
I believe it's 3 to 8.
3 to 8, yeah. Okay, thank you. Any other select for comment?
Sure. I'll go, Madam Chair. So obviously the Yankee Clipper has like an excellent history of very small, manageable events. My only concern, but it seems like Mike is already on top of it, is that obviously all state regulations are followed, and for each event, including kind of if they change between now and the next event, because as we know, things are changing rapidly. So I would just ask that he kind of be on top of the regulations, and obviously the new travel ban, but it sounds like the first one, that's not an issue.
That is correct.
Great.
Yeah, Mike had reached out to me. Thank you, Madam Chair. Mike had reached out to me and we had some discussion. We pointed him towards the Board of Selectmen, the office, to get all this done. And he told me the scope of what was going to happen and all that. And it seemed very reasonable. It doesn't seem like there are any issues. And Mike is well aware of conditions that need to exist in order to make it successful, both himself, the town, and the party that he's hosting the party for. So, Mike, I wish you well, and I know you'll be a good representative for your business.
Thank you very much, Don.
Ross, any questions?
No, I just want, Sarah kind of got my question, so.
Okay, great. And now I'll open it up to the public. Any public comment? Mitch, can you check the?
Sure. So anybody who wishes to provide public comment on this matter, please raise your hand, use the hand raise function. Dr. Wedmore?
Yeah, question more from the Board of Health hat. How many people will be attending this? And is it all going to be outside, or will some of it be inside and run a risk of too many people at a function early on when we're starting to open things up? And secondly, if this is outside, how loud is the music going to be to the proximate neighbors?
Let me try to field the questions one at a time. We are obviously keeping our social distancing, so we will be 6 people to a table. They will be 6 feet apart. We're expecting approximately 8 tables. So this event will be no more than 50 guests at this point in time. And unfortunately, due to the August 1st travel ban, we actually have lost a couple guests that were coming to the wedding. The music is one disc jockey, one person. Normally I apply for up to a 4-piece band. In this particular case, the music will not be incredibly loud and certainly will not go anywhere close to 9 o'clock. The event is completely outside. We have an arbor. That's where they'll be getting married. We have a patio, and we will be putting a couple extra tables on the grass next to that patio to make sure we can keep our spacing adequate. I'm sorry if I missed something, please ask.
Are a lot of the guests staying with the Yankee Clipper?
Most of them, yes. The whole inn is booked out for Friday night and Saturday night, and a couple rooms coming in on Thursday.
Is anyone else who wishes to do public comment on this matter, please use the hand raise function or raise your hand in your video, please. Madam Chair, I do not see any further comment.
Okay. Do I have a motion to close the hearing?
You do, Madam Chair. I move that the selectmen close the public hearing.
Okay.
Second.
Having had the motion, discussion, closing the hearing, having public comment, now I'll do a roll call vote. Selectman Campbell?
Aye.
Selectman Wilkinson?
Aye.
Selectman Murphy?
Aye.
Selectman Brackett?
Aye.
And Selectman George? Aye. Do we have Don, do you want to read the motion?
Sure. Madam Chair, I move that the Board of Selectmen approve an entertainment license for the Yankee Clipper Inn of 127 Granite Street to allow outdoor music on premises and outdoor PA system to expire on December 31st, 2020.
I'll second that.
Second.
Let me redo the roll call vote. Selectman Campbell?
Aye.
Selectman Wilkinson?
Aye.
Selectman Murphy?
Aye.
Selectman Brackett?
Aye.
Selectman George? Aye. 5-0. Have a wonderful event and season.
Thanks, Mike.
Okay, next I'll turn it over to Bruce for the COVID-19 data presentation review.
Thank you. Brief tonight. I know we have a very long agenda and we really want to focus, I think, on school-related issues. The entire presentation will be up on our website, and most of the slides are updates of things that we've seen. And my bottom line is things are looking good, and clearly the governor felt it was important to issue a very tight travel ban out of concern for potentially increasing rates. The Massachusetts rates are stable, but slightly increasing. We haven't seen the impact of summer visitors in Rockport, and perhaps maybe in the next week or so, we might begin seeing something from July 4th. But the bottom line is we certainly need to stay the course and continue being as vigilant, or in fact more vigilant, as we move forward. So let me just highlight a couple slides that we might not have seen yet. Let me go to the slideshow. Oh, sorry. This is a case count and confirmed COVID cases and persons tested. In Rockport, we've had 142 persons tested. Here we're talking PCR, and our positive rate is staying very low at 1.4%. In Rockport, we've had about 10% of the population receiving tests, which means 90% of the population has an unknown infection status. So there is the potential for infection certainly here. And you can see the decline. Rockport is the fourth bunch of bars over. And you can see the dramatic decline in percent positive, which is a good indication of things going well here. We've seen this before. There has been one new case, but case investigations, thanks to Teresa and Chassis, have been phenomenally successful so far. Again, my concern is the possibility of visitors as we open up, potentially spreading the disease, and case tracing, contact tracing becoming more difficult. This is new data that we haven't seen, which looks at the number of contacts per case per week. So for instance, in this bar here for June 7th to June 13th, you can see that there was, in blue, there were 2 new cases and there were 3 contacts for an average of 1.5 contacts per case. You can see in general, there have been relatively few contacts per case. Again, that's made tracing relatively straightforward. As we open up, this might become more difficult. This is PCR testing up to date. We can see in the last week where we have data, July 19th through the 25th, there were 20 PCR tests with no positives. This is just a table of the data from the previous slide. Again, there are essentially 2 kinds of tests. One looking for a current infection, and that's either PCR or antigen tests. And the second kind of test is antibody or serology tests. That is indication of previous infection, although it gives you no information about whether you're currently infectious. We don't have any data for July 19th through the 25th, but in the previous available week, there were 6 antibody tests, and 2 of them showed immune response. And the antibody tests, again, really, there's huge debate about how long immunity will last and will it be consistent across all cases. So although I think people right at this point are less concerned with immunity and more concerned with identifying potential spread using the PCR. And I think that's what drove the governor to issue his travel order. There's some more charts and graphs in here, most of which are just updates of things that we see we've seen in the past. This is total Massachusetts antibody testing. And again, Massachusetts has maintained a really low rate for PCR tests. And our hospitalization rates, you can see after a decline in Massachusetts, they have leveled off. I wouldn't call this a slight rise yet, but it's certainly not a continuing decline. And mortality has been fairly consistent. Again, the impact of mortality is 3 to 5 weeks in general after a potential infection. So we haven't seen the mortality impact of the opening around July 4th. I'll actually stop there in order to save time for other topics, but I'm happy to answer any quick questions folks have.
Bruce?
Yes?
The one new case from this past week, is that somebody from the community, or is that a person who lives in a facility? Maybe our public health nurses.
Teresa, you want to unmute? There you go.
I'm unmuted. Not a long-term care facility, is community member.
Okay, thank you.
Ted?
Yeah, to press that point, at the last 5 COVID updates, I believe Mitch said we had no new cases for 4 weeks and then 1 last week. Now, supposedly we're doing all that we can to not spread it, and yet by divine intervention or something else, this occurred. Do we have any idea how this came about from the public health nurses?
Yes, we do. I'm not sure that I want to speak specifically on a case in an open forum.
Thanks, Teresa. Maybe we can take that discussion offline between you and Sid.
Thank you.
You know, talking about fewer than 5 cases is difficult for me, given my public health training and concern for identifiability and privacy. But we can see if patterns are emerging as we do get more cases. And I think you two should, as clinicians, should have a private conversation about that. Any other questions or comments? Great. Ruth, I see the next item on the agenda is school-related updates.
I think we're going to put that towards the end of the meeting.
Yes, I see that Rob and Nicole and Jeannie are here. Is it your preference to have this later in the discussion? Or...
I think probably so we can spend more time on it.
Okay, sure.
We can get through some of these other quicker things.
Great. Let's kind of target that for maybe after your updates, Mitch. And item N, we'll slot in the school-related discussions then, if everyone is okay with that.
That's great. Yep, that's good. Okay, so moving along, Board of Selectmen consent agenda is next on our agenda. On the consent agenda this week is approval of minutes. We don't have any, except resignation of Henry Betts from the MAPC as the MAPC representative, amendment of lease for 134 Long Beach and 47 Long Beach lease to reflect the change in ownership. Do we have a motion?
Madam Chair, I move that the board approve all non-held items on the consent agenda.
Do I have a second?
Second.
Any discussion?
Just one quick comment, if I can. I just wanted to say thank you to Hank Betts for all he's done for the town. Anybody that gives their time and effort and energy to this town deserves thanks and praise, and Hank is no exception. So thank you, Hank.
Yep, that's great. And he will be staying on. He's still on CPC, I believe.
Yep.
For right now. So thank you. So roll call vote. Selectman Campbell.
Aye.
Selectman Wilkinson.
Aye.
Selectman Murphy.
Aye.
Selectman Brackett.
Aye.
Selectman George, I 5-0. Great, consent agenda done. Action items. The first one is approve and sign the, oh, well, Mitch, do you want to talk about this one now or later when you do your town?
So, Madam Chair, if you'd like, just to keep things moving, if you want to hold on the warrant, and then
Okay.
you want to just do the 2 and 3, I can
Yep.
address all of that together at the end. That would probably be best. Thank you.
Okay, great. We'll hold on that till later. Number 2 is Lantern Parade on August 8th, 2020. And I believe that was a citizen petition by Kate Flynn. Kate, are you on the line so you can talk to us about it?
So if you are on the line, please either activate your video, raise your hand, some way that we can know you're here. Madam Chair, I'm not seeing anybody activate video or raise their hand. Is there anybody else here for this?
Well, if there isn't, I was just going to quickly read what she had sent in.
Sure.
Date 8/8/20. It was date otherwise would have been slated for summer illumination evening. Event details: paper lanterns, battery powered as sold by the town. Parade lanterns to be carried by individuals. Distance approximately 10,000 feet to get daily recommended walking distance in. Specifics: mask required, 6-foot distance maintained at all times between individuals and family groups that have been together during COVID to maintain social distancing and precautions. Badges will be available to identify families or individuals. May walk in honor of a family member for unity or diversity. Onlookers to remain in their respective yards if possible, and or mask if unavailable to maintain a 6-foot distance. Proposed route: park at RHS, walk by Denmark, Marmion Way, Parcel Garden Beach, Atlantic Avenue, Atlantic Road, past Grammar Apartments and town, return to RHS via Parker Street or some semblance of this route as allowed to be determined, and the measures approximately like a 10K. Time, dusk, is at 7:55, so parking and start time would be approximately 8:15 p.m. For this event to occur, it would obviously depend on the willingness and desire of Rockport residents to participate and to be involved. If there is no desire, then we would not proceed. We can utilize the Rockport Facebook page to disseminate information and determine level of commitment and desire to proceed. Respectfully submitted, Dr. Kate Flynn, 3 Ridgewood Terrace, Rockport. And it was submitted on July 13th to the Board of Selectmen. Sarah, did you want to say anything?
Yeah, so it doesn't sound like Kate is here. I was going to suggest, I think this is the sweetest idea. I love the idea of people putting out the lanterns since we're not having illumination weekend. I just personally don't feel comfortable yet with approving any event or parade. I would suggest that maybe she obviously it's up for the whole board to decide, but I would suggest that they come back to us with the same request later in the summer and see how we're doing. And, maybe if between the Board of Selectmen, Board of Health, we're comfortable at that point, it can be an end of the summer, early fall. But at this point, I just personally don't feel comfortable. I understand all the precautions. It's just, I think we are doing such a good job, and I'm just not comfortable with it yet. But I love the idea, and at some point, I want to make it a reality.
Sounds good. Any other selectmen comments?
I'm sorry. Yeah, that's where I was going to go. Actually, I'd like to hear from the Board of Health and have them weigh in on this. I value their opinion, and I think that what they have to say would have a lot of merit. So, would anybody from the Board of Health like to weigh in on this?
Ron? Dr. Newman?
Thank you. I just think it would be hard to really monitor a parade. I don't know how long it would be, how many people are likely to be involved, but to monitor that people are keeping their social distancing, that they're wearing masks along the whole parade group, I think would be very difficult. And at another time, it may be an appropriate and wonderful thing for the community. But I agree with Sarah that it seems like it's a little bit early to approve something like this.
I concur with the consensus. I think the description of the precautions is superb, and this just is not the right time. We need to see how things go for the next month or so. If there is an increase, if there are concerns, if other issues emerge, before we consider large-scale gatherings, and this would certainly qualify as one.
Thank
So,
you. Barb, did you have something to say? And then Sid.
Yeah, I think we've already canceled a couple of parades for this year, so I think it is wise for us to wait and see how it looks. But I agree. I think it's a great idea, and we should have more to follow.
Dr. Wedmore?
Yeah, I think the most challenging thing we are going to have ahead of us is trying to safely open the schools. And I don't think anything should be thrust in the way of that, no matter how much apparent merit it has or enthusiasm by someone to potentially screw things up.
Any other comments?
I agree with.
Yeah. Oh, Paul.
Yes, thank you, Madam Chair. We've been really super conservative in Rockport, and I think that has helped bode well for us. And I think that we have to really make sure that we just make sure that we do what we need to do on this. But any type of parade or anything like that at this point, I think is irresponsible of us. So I'm not in favor of this. As much as I'd love to see this happen down the road and so forth, I'm gonna be on the be much more cautious on this, and I'm not in favor of this.
And I'd just like to say that I think it would be a wonderful event come fall, a lovely fall event, or people walking around with those if we can open up by then. And also the date is 8/8, and that's town meeting date. I think the town is going to have enough concerns of social distancing and getting the town meeting done. And let's go one step at a time, like everyone said. It's not quite the time yet to do something like it. It's a wonderful idea, but I don't think the time is right now.
And I'm just going to echo Sid's that we really, our eyes need to be on the prize of opening the schools right now. That needs to be the priority. We need to make sure we can maintain our numbers now, not bring them down so that we can get those schools open. It's got to be our next task.
So do I have a motion?
Just one more comment, if I may, Madam Chair.
Yes.
Thank you. So I too am in agreement with everybody, and thank you to the Board of Health for opining on that. Your opinion means a lot. It's valued. I also think, and I want to say completely that I'm in agreement with everybody, but I also think we need to have an eye on trying to restore a sense of normalcy to a town with events that are safe, that are presented in a safe manner. And I do agree with everybody that it is too soon for this right now, but I'm looking forward to that time very soon that we can have an event like this and feel good about it. You know, as the chairman said, it's, you know, we have town meeting that day. The timing just isn't right on this one, but I'm looking forward to very soon being able to open up and restoring that sense of normalcy to the people in town.
And we have no idea when that's going to happen. We have no idea when things are going to start really opening up, because things are going to be progressing and so forth. But let's hope that, you know, this happens sooner than later. But we have no idea. But we have to take a conservative approach.
If I may, Madam Chair.
Yes, Russ.
I don't see the parade as being the large issue in this, because you have hundreds of people walking around downtown. My biggest issue is that she didn't touch on the gathering when they're pulling into the parking lot and stuff like that. And that's where I think the biggest concern for me would be. That's where people are going to see each other. They're going to talk more. I don't see the parade part being that bad, but if she had included or been in the call with guidelines for people pulling into the parking lot and stuff like that, it would have gave a better perspective.
And that's good to be able to give feedback to her for when she does, if she brings it back again, when things do open up. That was a good feedback thing. Thank you, Ross. So do I have a motion?
Would probably
Oh,
be
it's
my
me.
motion.
Sorry. It's
Oh,
me.
sorry.
I move that the selectmen not approve at this time a lantern parade on August 8th, 2020 to begin at 8:15 p.m.
Do I have a second?
Second.
Okay, I think we've heard all the discussion. Thank you, Board of Health, for weighing in. And let's do a combined roll call vote. Selectman Campbell,
Nay, or, I'm sorry, I apologize.
Selectman Wilkinson,
Aye.
Selectman Murphy,
Aye.
Selectman Brackett,
Aye.
Selectman George, aye. Dr. Cohen,
Yes.
Bob McCarthy,
Bob,
Barb,
are you
are you on?
unmuted, Bob?
She was on the phone a minute ago.
Sorry, I had to jump on a phone call and I had to go mute. So, yes, I.
Dr. Newman,
Aye.
Dr. Wedmore,
Yes.
and Mary Beth Murphy?
Yes.
Great. So, no to that. But we'll hope that they'll come back for a future one. It's a great idea. And when this pandemic is safe to proceed, we certainly want things like that to go on. Okay, the next item is another one that is sort of a joint thing too. Rockport New Year's Eve Fall Event at Millbrook Meadow. Do I have a motion?
This has an approved and non-approved with it. Should we do the discussion first?
We can. So
Okay.
do I have, Jeff Lyons did the proposal. Jeff, are you on the call?
Yes, I am.
Okay. could you-
Madam Chair, if we could just do the motion so we know what we're talking about, I think that might be helpful, and then we can go back and either approve or not.
Well, okay.
Madam Chair, I would say that you, normally, I would agree with that. I would just offer that since you've got two options in front of you for this,
Yep.
it may be helpful for this particular one to offer, to discuss first.
Thank
Okay.
you, Mitch.
Okay, so Mr. Lyon.
It has become apparent to us that it will not be possible to have a full-scale event on New Year's Eve as we have in the past. We have been trying to think that as the Rockport New Year's Eve Board of Directors has been trying to devise a way that we can have some kind of an event. And the idea occurred to us of having a concert that we would video record, and then that recording could be part of a virtual event on New Year's Eve. We would also like to provide an opportunity to the community to be able to see some live music. There are some local bands that people haven't seen in a very long time that have a good following that we believe people would very much like to come out and see. We have developed a comprehensive COVID mitigation plan that involves 12-foot squares for the people attending the show and 6-foot one-way aisles so as to try to minimize contact between people. That's what we would like to do.
Okay. Discussion.
So how does this differ from the previous request?
Later date.
Later date, but I mean, I'm just thinking overall.
Yeah, unfortunately, I don't think it is. I mean, honestly, I was totally impressed with the plans, the layout, the squares. And Jeff was kind enough to say that, if they got approval, then we could revoke it if we had to. But unfortunately, I think we have to work the opposite. I think kind of as things unfold and guidelines and restrictions, even as tough as it is on planning, I think they have to come back to us maybe early fall. But unfortunately, it's the same situation for me, which I just don't feel comfortable approving something at this time. But I love the idea of a virtual New Year's Eve. I will totally participate in it. But I just, unfortunately, right now can't support something live until we kind of have a bigger picture of the fall.
Okay. Other board members and Board of Health.
Yeah, exactly. I defer to Board of Health again on this one.
I guess I think there's a consensus that we need to stay the course, certainly until early fall when we have a better sense of what kind of gatherings might work best and what the situation is, and after school opens. I certainly agree with Mary Beth's perspective on that. So I I think we need to continue to be very conservative, and unfortunately, that's going to affect plans for some larger events that we all welcome and enjoy. It's just the virus will determine the timetable, and we need to be vigilant right now.
And I don't think we can say yes to one group and no to the other group. And, you know, I think we have to be consistent. Thank you. I agree with you, Dr. Cohen.
Any other Board of Selectmen or Board of Health comments?
Oh, his submission is quite comprehensive. So does anyone have anything that they would recommend that he add on to it that would change anyone's mind? Or, I mean, he's following guidelines, you know.
Is it, I'm going to throw this out there, Jeff, and I don't know if this is something that you could consider, or even if the board would accept. But rather than have an event with people in attendance, you had said that you wanted to present this at the Rockport New Year's Eve celebration that we have. Is this something that potentially you could, and I know this is kind of antithetical to the whole thesis of everything, but can you have the concert with no attendance, just the bandmate, just the bands, tape the event, and that way you have a summertime setting that could be played on New Year's Eve? I'm not even sure if that's something that would work or would be acceptable, but it's just kind of an idea.
Yes, that can be done. The drawback, of course, is that without a live audience, there's a lack of energy to the performance. It's less compelling.
Right.
And were the donations going to be used for the later event, or?
We don't expect that the donations, as we have this described, would cover the cost of the event itself. If there were any surplus, it would go back into our reserve to be used for the later event.
I mean, it just stinks all around. Like, this is what, you know, this is one of the things. It's like, it's like when you walk by the Shayla Lou and it's dark, you know, it's like music and, you know, it's just, this is one of the things that unfortunately now we just have to wait it out unless, you know, I know people are being creative with virtual stuff, you know, and virtual concerts and that kind of thing. But unfortunately, I'm just not comfortable with, you know, with a live thing in town right now. But
And I think too, we're hearing a lot of virtual concerts that can be done and taped and used for New Year's Eve. That would be a wonderful thing. But I think you're not seeing, like we heard on the school committee call last night, that they're all their musical things and band and things like that all have to be outside. They can't be in the closed area, and they're still even concerned about that. So that would be difficult for the bands to be down there. We're really not having any groups, whether they're bands without people or not, really in the Meadow this year, I think, is what we've been pretty much saying. Ross, did you have another comment?
Well, I mean, from what I can take, it takes the guidelines from what the graduation is doing, which we already approved. And then I have a question. How far away is the stage from the front row guests?
It would have to be 25 feet.
yeah, and I mean, Ross, just to put it out there, I know the graduation was a Board of Health event, and I understand the situation, but I personally, Selectmen, I would not have voted in favor of the graduation. Just that's my, I'm just one vote out of many, obviously. But just so we can, I'm just kind of being consistent across the board.
Okay, any further discussion? Oh, Dr. Wedmore?
Yeah, we did discuss the graduation and we agreed with it. But the graduation is a summation of 12 years of kids' efforts, time in the school, interactions with their teachers. And that, I think, is worthy of more acknowledgement than the passing fantasy of I'd like to have a concert this summer. So I don't see those inconsistent.
Thank you. Any other comments from either board? I believe that it sounds like that most of the comments have been not supportive of it. So do I have a motion, Selectman Campbell?
Yes, Madam Chair, I move, let me just find my motion here. Here we go. I move that the board not approve a concert fundraiser to be held in Millbrook Meadow in late September as detailed in the plan submitted.
Do I do it? Seconded. Thank you. We've already had discussion. Again, I think I'll do a roll call vote with both boards because it really is. It's just like the last one. It's really comes to the selectmen, but since we have Board of Health with us, I think it's good to have their input and stuff. Roll call vote with selectmen. Selectman Campbell?
Madam
Yeah.
Chair, point of order. The Board of Health hasn't seen this proposal.
Okay.
So I feel it's not appropriate for us to vote on it. The other proposal was described and read to us in full. So
Okay.
I think we provided our opinion as appropriate to our role, but I would feel uncomfortable personally, and I think for our board to vote on a proposal that we haven't seen.
Understood.
Is this something, Madam Chair, that both boards are required to vote on? Because
No.
if not, we can, no?
We'll just do the selectmen.
Okay, I just want to make sure that if not, we can hold it off to our next meeting.
No, it came to the selectmen.
There would be no point in it.
What's that?
My comment was there would be no point in holding it off. I mean, the decision looks like it's the authority rests with us. So, you know, let's just make the decision and move on.
I just want to make sure it's not required between both boards.
No,
It is not.
Okay. It's not, okay, good. No, thank you.
Yeah.
Mitch, it's not, correct?
That's correct.
Okay.
Thank you.
So roll call vote with the selectmen. Selectman Campbell.
Regrettably, aye.
Selectman Wilkinson.
Agree, regrettably, aye.
Selectman Murphy.
Aye.
Selectman Brackett.
Aye.
Selectman George, aye. Hopefully they can come back like the other one if things change down the line and later on before New Year's Eve time and things get straightened away. We certainly would like to entertain some other ideas once things are safe to proceed, is how I feel.
Thank you for your consideration.
Thank you.
Thanks, Jeff.
Next is Board of Health. Bruce.
Okay, we have two sets of minutes to review and approve, July 2nd and July 14. Do I hear a motion to approve the July 2nd minutes?
I move that we approve the July 2nd minutes.
Thank you, Mary Beth. Do I hear a second?
Second.
Any discussion around July 2 minutes that we've all received and hopefully had a chance to review?
Nope.
Great. So all those roll call vote in favor of approving July 2 minutes. Barb?
Yes.
Sid?
Abstain, I was absent.
Ron?
Yes.
Mary Beth?
Yes.
And I vote yes as well. 4-0 with one abstention for those approved minutes. July 14 minutes. Do I hear a motion to approve?
So move.
Second?
I second.
Great. I submitted one correction in my review that I think you all saw that has been incorporated. Any further discussion on July 14 minutes? Okay, roll call vote. Barb?
Yes.
Sid?
Yes.
Ron?
Yes.
Mary Beth?
Yes.
And I vote yes as well. Those are approved unanimously. Beach water quality.
Bruce?
I asked Leslie, oh, I'm sorry, Sid.
Yeah, I wonder if that would be something would be better left when we have our next meeting so we don't chew up the Board of Selectmen's time.
Exactly. I had essentially asked Leslie to say exactly what you said, Sid. She's working on preparing a proposal for our review when we can focus on this issue and meet just unitarily as our board. So if that's all right with you, Leslie, I will postpone this discussion till the next meeting. Thank you. Item I, testing, contact tracing. Teresa, Chassis, any updates?
I don't have any updates right now.
Chassis?
I mean, I might just say we're definitely receiving contacts, and I will send updated data next week on contacts. So I would just say the system is working. We're receiving notifications of Rockport contacts, and we're reaching out to them, and that I think is just getting stronger. Our ability to network among public health nurses and get that information, and maybe just starting to see the hints of some increased activity, which, is inevitable, and we'll do our best to institute the isolation and quarantine orders.
Do we have the capacity, so do we know what proportion of the contacts who are Rockport residents are contacts for cases that are not Rockport cases?
Yes, we do know that information, and we've passed along that request to our colleagues with ISIS or Maven, saying that kind of as we improve the Maven database, it would be nice if those were some questions that could be easily extracted into a report, how many contacts per case in different settings. So how many household contacts, because I kind of went through and manually did it, which was fine for the town of Rockport, but it would be really difficult in a larger city. And they've asked us for that feedback, like going forward, how can we better capture information in reports that you all are asking about. So I think in the future we'll be able to report on that in an easier way, but right now it's kind of tedious.
I think that's really, in a town like ours where there are an enormous number of visitors, in addition to the residents, understanding how many of the contacts are from local exposures versus exposures from people who live elsewhere will really help us understand the nature of the epidemic here. So that would be great. If you need any board support to move that request along, I think that would be really helpful.
Yeah, and I think we'll have more information as people who travel here fill out the attestation. I think that information will come to the Board of Health, and that will help fill out that picture of who's coming from where, whether they've been tested or, things like that. So, but that we're still learning, on each DPH call, we're getting a little more information. We don't fully understand how it's going to work, but I think that will help round out those questions that people have been asking.
So I can, I was on a DPH call earlier today, and I could give a brief update about that. So a system, as all of you know, the travel guidance is developing a system where people online who are traveling in-state to Rockport will be filling out online travel forms. That information is going to be compiled in a database that we will have access to. Also that database is being created for persons who need to quarantine here in Rockport. They will receive daily texts from the state reminding them of their status until they're through their quarantine. We will have access to that information just so that we know who to follow up for quarantine, rather than we're not anticipating proactive enforcement. For lodgings, on the DPH call said are instructed to put on their websites, and when they're booking reservations, to make people coming from other states aware of the travel restrictions, and they will be required to remind them when they show up at their Rockport destinations about completing their travel forms. But again, they're not intended to be an enforcement, have any enforcement function. So just thought that was interesting in today's discussion.
Can I just ask, Bruce?
Yeah.
For our public health nurses, have you been asked to enforce this in any way or to monitor it, or is it all being done centrally through the DPH? You know, if there are 50 people who are in quarantine for 14 days in Rockport, do you folks know who they are or have any responsibility for them?
Well, it starts August 1st, and we've been told that we'll have access to the information, but we won't be asked to act on it necessarily. But I think we would like to know that the information.
Mm-hmm.
I think compliance guidelines are being established now in more detail by the state, and we'll be receiving a lot more information about how to do that as we move forward, Ron. Barb? Sid? And
Yeah, I
Teresa?
just think, you know, just to complete the conversation around testing, we expect that we'll probably have some rapid testing capability by the end of August for selected cases, and that's a huge benefit to our system. We are also seeing that our supplies are still variable, whether it's analyzer reagents or quality control things or test kits, or we just can't get that stabilized. So it's a fragile lab infrastructure system that we work hard every day. We probably test about 220 folks a day. What is interesting, the last week on one of our calls internally here, there were 2 or 3 surgical cases, not necessarily from Cape Ann, but 2 or 3 surgical cases that were screened preoperatively that were surprised that they were positive. So to me, that means that sends a red flag off in my brain that everything we've talked about is absolutely headed in the right direction, that we need to keep our wits about us and make sure that we're really low to the ground, keeping an eye on that. We're also on high alert for a change in sort of status of the folks we're seeing. We're going to be seeing kids from daycare. We're going to be seeing kids from college for testing. We're going to be seeing kids for school. So the signs and symptoms that those folks present are going to either be negligible or very different than what we've seen in the elderly and the older adult to this point. So we're on alert for that as well. And we also are talking about pool testing. And pool testing says if you've got a bunch of folks that you think are going to be negative, then why not put 4 samples together, run them together using a simple set of singular reagents, and if they're all negative, then they're all negative. So we're looking at criteria for that as well, knowing that we have pockets of requests that come to us from samples that we expect to be negative, and it would also conserve our supplies as well. So that's kind of where we're at.
Great. Teresa, I saw you and both Sid had something you wanted to say?
Yeah. Once again, I'm perplexed about the state. They have put in place this whole travel rules. They've put in place a organization to collect the data with no intent whatsoever of doing anything about it as far as enforcement. I find that a fool's errand.
Well, they've come up, I understand the frustration there. You know, enforcement at every level has been difficult, whether it's, you know, face masks or testing or social distancing. They are trying to beef up compliance, and there were guidelines today because they anticipate more complaints may be made. So there's a statewide line to contact if there are any concerns about compliance. It's, excuse me, really difficult to task local boards of health with compliance for these regulations. But you're right. most, we're relying on the responsibility of individuals in the public to a great extent. And if compliance is necessary, I think as we move forward, there might be more serious efforts made to have people comply with not only the recommendations, but the regulations. I don't know whether anyone else wants to comment about compliance. I have one other thing to add about testing. Some people are using the rapid response antigen testing to determine whether someone is currently COVID positive. The state will not accept that for travelers. Everyone should be aware, particularly lodgings, if anybody is making reservations and they ask about testing, I think they need to make sure that folks get PCR tests. DPH website has a list of acceptable tests that they can be used in lieu of a 14-day quarantine. And I think there will be some more documentation coming out from DPH about strongly discouraging the use of antigen tests to determine current COVID status. So,
Bruce?
Yes.
Question, is there an exception from the quarantine in that one once comes across the state border? How do you go to get a test whilst you're being quarantined?
You can go get, when you cross the state border, you can go get a test or you can seek medical care. Those pretty much are the only exceptions to the quarantine. There are other exceptions for people who live near the border and can cross and stuff, but that for those who are subject to the 14-day quarantine, those pretty much are the only two exceptions that would affect us here in Rockport.
Thank you.
Ron.
And I would think it would be important to include this travel advisory in our code red for next Monday, which is must be around the 1st of August, just to let residents know that this is in place. And people may be planning on having relatives coming up, etc. And I think, I'm sure there are people who don't get the paper and may not be fully aware of the implications.
To your point, Dr. Newman, I did include it last night.
Was it included? Okay.
It
All
was.
right.
I'll continue that weekly. I'll make sure that's one of the standing items.
Great. Thank you.
Yep.
Great. That concludes section I. Ruth, turning it back over to you.
Okay, J, considerations of current or additional restrictions relating to COVID-19. Mitch and the Board of Health.
Thank you, Madam Chair. So the requirements in place are rapidly dwindling at the moment. The office did get some inquiries regarding the placement of the porta potties at the beaches. We had held back on placing those because we did not have a way to clean them on a regular basis. We still don't at the moment. But I did want to be sure that both boards were aware that request came in and see if you wished to take any action related to that.
Well, I've heard from a couple people that were upset about it, that more people are using the bushes and the rock areas around the beaches for bathrooms. I have looked, and all of Gloucester beaches all have theirs. And I'm just wondering if maybe now is the time to put them out with a sign that says they will have their routine maintenance, but they are not, routinely sanitized or cleaned, and you're using them at your own risk. I'm just wondering if that is anything that we could do to try to get them out there. It's certainly, the people are at the beaches, whether they're locals or whoever, they are there at the beaches. Any other comments?
I'll jump in here. I think that I agree with you. I think there's a way to do it. If we can open public restrooms and have those cared for in the correct fashion, perhaps that the porta potties would be acceptable as well, as long as agreements were reached with those servicing them, that and as far as sanitation and COVID restrictions and things of that nature. So, I mean, I'd like to see them. I think it's been an unusually hot summer, and I think people would appreciate them.
Just one point, if I may, regarding the comparison with the restrooms. There's running water and electricity at those. So those
Okay.
are, that does make a difference for the DPW staff.
Okay.
But if the
So
board
who services the porta potties? Is it town done or is it a contractor?
contractors, right now, but it's not, it wouldn't be something that we're able to go in with the sanitizer or do like we do with the public restrooms. If the boards wish, we can put them out and put the signage on them, but you know, I just want to be sure that the boards are making a determination on that.
Right. So where do we have porta potties in town?
So pursuant to the Board of Health's order last year, I believe every beach has them, correct?
Not Old Garden.
Old Garden,
Yes.
Cape Edge.
They do?
Long and Pebble, or not Pebble, but Cape Edge.
And long.
Yes, I said Long, yep.
Wait. You guys cut out. Old Garden Beach does not have.
No.
Yes, it does.
It does?
Back
It
beach,
does. Okay.
Old Garden was going to have them. They had them last year. Pebble Beach had them, and Long Beach.
Okay.
And transiently, the head of Cape Hedge Beach had it, and then that was negotiated with the Concom, and they agreed to have it, their land hosted for it.
Mm-hmm.
Yeah, this is Sarah. I would defer to the Board of Health, honestly, because I know the challenge is the town isn't able to service them. So, you know, if the Board of Health is comfortable with porta potties that are serviced weekly or whatever the company does, then I'm fine with having them out. If they're not, then I say we keep them out. Either way.
Board of Health, Ron, I saw your hand.
I don't know how well those things are ventilated. That would be my concern. This is a disease spread mostly by respiratory droplets and maybe aerosols. I'm not as concerned about touching surfaces because there's usually hand sanitizer in the porta potties. But I have a sense that unless there's a brisk breeze blowing, it's pretty stagnant in those things. And I just don't know how safe they are. I don't know if there's any literature that we can review.
I haven't seen any state guidelines for maintenance and cleaning of porta potties. I can ask DPH. Mitch, I don't know whether or anyone is aware of specific guidance for cleaning.
I haven't seen any. Barb, I know you're regularly checking as well. Are you seeing anything?
Once again, if we have the benefit of hindsight and having other towns that are doing this, perhaps it's a couple of phone calls to find out what they're doing and see what kind of precautions they're taking. I'll do it. I'm not trying to put it off on anybody else. Yeah. I'm happy to jump in and help out.
So, Mary Beth?
In years past, I thought that having the porta potties at the beach was a great idea. But just my experience at the beach is that they're very crowded. And I think if we encourage people to spend less time at the beach and the police are doing a great job only letting certain people in the parking lots and enforcing parking. But I think porta potties this year is sort of sending the message to sort of go to the beach for the entire day, and then it limits the other people who can go to the beach. So I think this year it might be a good idea to not have porta potties, and maybe that might limit people's time on the beach.
Sid?
I'm not sure that will, what's going to happen. We'll hand out this later.
Sid?
I want to hear more from other people.
I think nonetheless, there's a biological imperative. When you're at the beach, if there's no porta potty, there's a bush that you're going to use, and that ends up in the ocean. So the question is there more risk of getting COVID by being in a porta potty for a minute, or having your kids walk through the area which is being used as a sham toilet? And I think the porta potties do provide a benefit.
I thought the suggestion of finding out how, I know Gloucester, you say, has their porta potties out. Are there other beach communities here on Cape Ann that we know have porta potties at their beaches open now?
I think I heard that Manchester also does.
So could we investigate what they're doing in terms of cleaning and usage and consider this at our next meeting, board meeting?
Yeah, we'll have the DPW call over to them.
And find out exactly what they're doing. And let's postpone this discussion until our next Board of Health meeting, if that's all right with folks.
For what it's worth, there is a porta potty at Granite Pier. Someone is either overlooking that or servicing it.
So that's the sense of the Board of Health. If others on the Board of Selectmen want to offer suggestions or advice, you know, we're certainly open.
Well, I'm friends with Brett Ramsey, who owns a company like this in Gloucester, and I'd be happy to call him to find out what he's doing and if he has any municipalities or even outside, any private that he's using. So we can try that and see what he says.
Thanks, Don. The more information we have, the better our decisions will be. So
You're welcome.
Can add to this conversation, I think that would be helpful.
Will do. Thank you,
And
Doctor.
I'll run this through the Selectmen's office. Would be great.
Yeah. Mitch, who do we use currently?
I honestly, I'm not sure, Ruth. I can find out and let you know.
Okay, great. Well, that was good. Good to talk. Anything else, Mitch, that you want to add into that of considerations, current restrictions?
That's been the most recent one. The other restrictions, the significant restriction right now is the mask restriction. And that's it.
Okay. Any other discussion on that? Not seeing any. Let's move on to K, long-term care and congregate living facility update. I did my calls today. I spoke with Millbrook Park. They're doing very well. Old Farm in Supportive Living and Pigeon Cove Apartments and Rockport High School Apartments all are doing well. We have no positive cases that they know of, and all of their staff are doing well. They're very appreciative of the calls each week. And they're starting to, for example, Rockport High School Apartments had a little, they don't have their community rooms open. They're limiting their visitors to just medical personnel. But they did put some tables, chairs, and umbrellas out so people could social distance outside. And they've been doing very well at that. So she was happy about that. But their residents are doing very well. Chassis or anyone, is there anything on Denmark, any updates?
Cassie, you sent me something.
Yeah, things are stable at Denmark. They reported this week they're 3 weeks of COVID-free, so they continue to do surveillance among staff and residents and have not seen any symptomatic individuals. Their last audit was maybe last week, and they passed that audit, so things are going well.
Wonderful.
Yep.
Great news. Okay, L, reopening advisory group updates. Sarah and Barb.
Sure. Hi, Ruth. Sorry, I had to switch over to just audio. And Barb can kick in at any time. Reopening advisory group has been busy. We had a meeting today. We have a lot going on, a lot, just updates with outdoor dining, and we're now kind of shifting to work on how we can assist businesses with the new travel ban that's starting. So that's kind of an ongoing discussion. Outdoor displays, we kind of have a lot going on, and we'll probably have more to report next week. Barb, do you have anything to add?
Yes, we had some discussion at our meeting about how to handle when someone refuses to wear a mask. and Mitch and I did some research on ADA guidelines, and it's a reasonable accommodation, a good resource that gave us some great alternatives, and we'll turn that into something that the business owners can use. And I think we're seeing a few industries pushing back on medical exemptions of masks. So the airline industry did that, saying, you know what, if you're not wearing a mask, you can't fly.
Yep.
That we're seeing folks not accept a medical exemption as quickly as we would have probably 2 months ago. We need to understand that. We also need to help our businesses manage that, and the business owners. So we think we found a good resource that will help them do that.
Good. Yeah, great. Just to add one more thing that I forgot, I also I spoke to Mitch earlier today. One thing the business owners have kind of asked us repeatedly is just more support about surrounding the downtown mask order, kind of more signage. I know the town has on order, but materials are back order, but we're waiting for more signage. I also suggested to Mitch today, and I think he agreed, that it would be helpful if the electronic sign downtown said, right now it says wear a mask, if it said masks required downtown. I think just that, quick change could be very helpful in letting people know to at least, ask. But that, in addition to other signage, could be really helpful.
And if I could also add, I'd like to, I've heard from a couple of business owners down on Bearskin Neck, if we could have a sign that said that Bearskin Neck stores are open because of the detour. A lot of people apparently feel that, Bearskin Neck is not open. So if we could have that, a sign there, that'd be great.
Certainly sounds reasonable.
Yeah,
Okay.
and we've Paul, we've talked about the traffic pattern down there at all of our meetings as well. You're right. It's a little complicated for folks, and it does come up at every meeting.
Yeah, just as long as I think people come by and they see the detour, they think that, you can't go down to Bearskin Neck. So if that could be happening, I'm sure that'd be helpful. Thank you.
Sarah, Barb, did you guys get any feedback about the travel ban from hotel and motel people?
From who? You broke up.
Oh, sorry, from the hotels and the motels here in town. Information about the travel ban and how they feel about it, how they think they're going to enforce it.
They've had some cancellations. They've actually had some cancellations. They've had folks that, if you're coming for a week and you need to quarantine for 14 days, that doesn't sort of match. And they've not encountered it yet, but they know that they're going to need to sort of do some sort of demographics and make sure that folks fill out the form and talk about testing and what's been done. So we told them we'd stay in touch with them around that, because that will be tricky for them. But there have been cancellations for sure.
Dr. Wedmore?
Yeah, with respect to the signage, I'd like to see marketing that becomes more positive. For example, instead of saying wear a mask, if one were to phrase it like, protect your friends, protect your relatives, wear a mask and do your part to defeat COVID, that's sort of like what we did during World War II, rather than saying you must buy war bonds.
Yeah.
But I think there's more ability to enlist people depending on how you put the message out.
Very true.
Yeah.
Good point. And maybe that could all be on the signboard if they can do small enough lettering that just is something positive, and please do your part. Bearskin Neck and the businesses are open, but mask mandatory when downtown, something like that.
Yeah, we'll try to find something that where the messaging is direct and short enough. The signboard has a limit of 3 lines per message, the electronic one. So that one is by nature always a bit more pithy in the message that it conveys. But as we work through some of the other signage that we deploy downtown, we'll certainly be cognizant of how we can make it a little more, in how we phrase it.
Yeah. Or even use the one up on Great Hill when you're coming into town. Put one back up there that, you know, spells it all out, that hangs from the signpost up there maybe. Next is outdoor display application approvals. I think Sarah's going to speak to that. And Sarah and Bob, do I have a motion to talk about that? Sarah, do you
Sure.
have the motion?
Can some, I don't have the motions in front of me. Can somebody else make the motion and then I'll speak on it?
Sure, I can take it if you want.
Thanks so much.
Yep, no problem. And let's go with, I move that the Board of Selectmen approve outdoor displays for the 2020 season. Ken Knowles Fine Art, 10A Main Street, Bearskin Neck Motor Lodge, 64 Bearskin Neck, Rusty and Ingrid, 8 Bearskin Neck.
Do I have a, thank you, Paul. Discussion, we'll hear from Sarah and we'll also hear from maybe Mitch.
Yeah, great. I know that Mitch is going to speak about the Ken Knowles application. I think there was some concern that it doesn't totally, that the initial application didn't totally fall in line with the regulations. So I'll let Mitch speak to that one in a minute. The Rusty and Ingrid one looks fine. The only issue is that there's a print thing. We have to make sure that it doesn't become the sale of prints outside. And then the Bearskin Neck Motor Lodge, they actually brought that up in a business owners meeting, and that one makes sense and seems appropriate.
Great. Mitch.
Thank you, Madam Chair. So the board has, I believe, the correspondence related to the request for Ken Knowles Fine Art. I believe Mr. Knowles is also here as well. I believe he's had some conversations with Debbie in this office relating to his request. So I would suggest that perhaps the board ask him to share what he'd like to do.
Please do.
Ken?
And if you want to just accept the unmute.
Hi there. Thank you for having me. And so it's really very simple, and I understand where I was a little outside the regulation, the restrictions on the amount of, I believe it was the amount of displays is limited to 2. And I don't have a problem with that, and it can be 2. The description of it is basically, if you're familiar with what a high top table is, it's about 4 feet high, very small round table. The ones that I have to use are about 18 inches round. They'll have a tablecloth on it, and it'll have an invitation to come in the gallery on it. So it's a design to attract someone to walk over to our storefront and see that they can come in and to be invited in. So because art galleries and other businesses like ours thrive and live off of doing receptions and shows, we're unable to do that. And by no means am I intending to invite anybody to anything. I'm not. And we've been actually operating under basically the same guidelines we were given on phase 2 when we opened on June 8th. And we intend to continue to operate that same way. We have a little courtyard next to us that is ours. It's rented property of mine, and that's where we intend to put them, not on the sidewalk, not in the way of the sidewalk, not sticking out into the sidewalk in any way. That really is it in a nutshell.
Great. Any questions from the board? Selectman Campbell?
No. Kenny had been corresponding with me. We've been talking about this, and once again, I directed him into the board, into the office to go through this. And what, you know, in a general sense, you know, we need to do what we can to support these businesses downtown, which I know this board is very business friendly. I think it's going to be done in a responsible way, and I believe if it needs to be scaled in some way, perhaps Ken could present some alternatives if that's something that's would be workable.
I don't have any problem with this request, considering the situation, what's going on.
Ross?
I think it looks great.
Sarah?
Yeah, that seems fine with me. If he puts it down to one display, I think it's fine.
Yeah.
Great.
Oh, I'm sorry. I thought it was 2.
Oh, so one table and the easel, is that what we've come to?
I was hoping for 2 tables.
Oh.
And I personally don't like putting my paintings out in the sun that much, so I would be willing to like sacrifice the easel rather than.
Oh, okay.
So now if I have this round table, small round table, and I chose to put a small painting sitting on that table, would that be okay?
That's still that would be considered a display. So that would add to your count. So you just
2 of
need
those and I'm okay? That's what I'm asking.
2, yep.
Okay.
Yeah, I personally think 2 is fine, and whatever mix and match Ken wants to do is totally fine with it. I'm fine. I think that's fine. I think it would look really nice there.
Yep.
Great. Okay, so we've heard the motion. We've gotten a second. We've had discussion. How about a roll call vote? Selectman Campbell.
Aye.
Selectman Wilkinson.
Aye.
Selectman Murphy.
Aye.
Selectman Brackett.
Aye.
Selectman George, aye. 5-0.
Mr. Knowles, just if I could, just so we have the correct photos of it on record for compliance purposes for the building inspector, if you would just do the setup the both ways that you may end up doing it. That way we have photos of both ways.
One being an easel and a table, and one being 2 tables? Okay.
Yeah, just so we have that for our file, and that can be shared with the inspector if there are any questions that come up.
Sure.
Thank you.
Thank you, Ken.
Yep.
Next is Town Administrator Incident Command updates.
So, Madam Chair, if you'd like, we can do the warrant now as well.
Okay.
So the board has the town meeting warrant in front of it. It is a truncated warrant at this point, following the board's directive from the last meeting. So we have all of the standard articles on it, all the required articles. And in addition to the scaled down items, there are all 7 of the petition articles are on there. The moderator, to my knowledge, what he conveyed to me as of this morning, he's spoken with all of the petitioners, and I believe 1, 2, 3, 5 out of the 7 have agreed to defer to a future meeting, but all are included on the warrant as required. So the board has the warrant in front of them. It does look different than we normally would for a meeting. We are not able to take any action with this warrant relative to FY20 like we normally would. Typically, you'd see those Roman numeral articles at the top of the section. Based on some discussions with DOR and Town Council, we're not able to do that, so that we had to reshuffle a little bit to make some things work. So based on the latest advice on everything, and as of this afternoon, this is the warrant prepared for you as requested in a truncated version. 3 articles were not included, the 2 zoning articles and the balloon ban. Those matters can be reconsidered by the board at a later date.
Indeed.
Okay, Don Campbell?
Yeah, Mitch, who were the 2 that didn't want to defer?
The moderator, I believe, indicated that fluoride intends to proceed, the non-binding fluoride petition and the Straight Smith Way parcel non-binding petition are planning to proceed.
Okay, thank you.
I've not spoken with them. That's just what Bob has conveyed to me.
Okay.
Dr. Cohen?
Could you please send to the Board of Health any warrant articles that you think we need to weigh in on?
I will.
As soon as you can.
Yep, absolutely, Dr. Cohen.
Thanks.
Any other comments on the warrant? Or do you want to also at the same time go over the other page you sent us, the free cash part?
I can certainly, Madam Chair. So the board had previously approved back in March the free cash usage plan. based on where we are now with COVID and trying to be a little more cognizant of things, this was discussed last evening with the Finance Committee, and they have approved the plan that the selectmen have in front of them for the modified free cash. The areas that we've flagged, instead of 100,000 to general stabilization, we're putting 50,000 for sped stabilization instead of 100,000, moving to put 200,000. The capital requests, the specific projects, that amount was reduced by 200,000, a little over that, to accommodate some other needs related to COVID. So that amount has been reduced from 677,605 to 427,605 for those projects. In essence, 2 projects were removed from the list, and it was the Harbor Master Patrol boat and the school bus. Additionally, you will see 2 items listed on here. You'll see the COVID, it says COVID at the top, 244,000, and FEMA matching 56,000 at the bottom. Starting with the FEMA matching item, which is also a standalone article on the warrant. The board had previously considered from DPW two FEMA articles in the past. There was the large Long Beach one, and then there was this small projects one. And the board at the time had said, we need a contract. We need FEMA's contract in place to be sure that we have a very clear number and that there'd be no wiggle room on that. It needed to be black and white. We do have the contracts in place, and the town's matching portion for the storm damage repair work on T Wharf, Bradley Wharf, Pigeon Cove Harbor roadway, and White Wharf. Our portion of that is $56,000. So probably the one that most folks deal with most regularly is that, as you know, half of T Wharf is paved, half of it is not. It's been pending repairs. That is one of the 4 projects that would be addressed with this matching fund. The COVID account, so one of the items that was raised very helpfully by Finance Committee was the need to ensure that we have the flexibility to respond to anything that comes up unexpectedly from COVID. So we certainly experienced a significant amount of costs associated with COVID in the last fiscal year, and we made it. We made it work. We had to. We were closed. We utilized funding on the general government side. The majority of that came from, for expenses, came from the Office of the Board of Selectmen. We stopped everything and shifted everything towards COVID. That is not a sustainable model for us, and that skews the operating budget. So what we've proposed here, it's been accepted by the Finance Committee, a standalone article and a standalone fund to respond to COVID costs that come up for labor costs and expense costs. So expense costs are everything from the shields that we have to the 55-gallon drums of hand sanitizer and the electrostatic machines that we have to sanitize facilities. And on the labor side, all of our mask details that have been downtown, the additional ambulance staffing that we've had to do, and a variety of other matters that are directly related to COVID. What we would do with this fund, everything would be charged to this fund. Labor and expenses would be charged to this fund. The way it's set up, it would be as a standalone item. It could carry over fiscal years unless the town opts to do something different with it. So if we find that come next April, there's not a need for it, it can be repurposed. If not, if the need continues, the funding is still there and it's available, and it does not put a strain on the operating budget. An important point to also flag here, this not only benefits our general government needs, this will also benefit the school needs. And I've had that conversation with the superintendent. They're certainly facing, as everybody is well aware, some significant costs coming up. So this would basically avoid that shock in the operating budget. That's not something that's helpful for any of us to have. So this redeploys some of the money to ensure we have the flexibility we need to respond to the COVID crisis.
Great.
Other than
Sounds good.
that, it is unchanged. Again, Finance Committee has approved for their portion of this.
Thank you, Mitch. Do we have a motion?
I have a
Any
motion, Madam.
discussion? Okay, do we have a motion?
I do. I move that the Board of Selectmen approve and sign the August 8th, 2020 annual town meeting warrant.
Do I have a second?
Second.
Thank you. Any further discussion? Seeing none, roll call vote. Selectman Campbell?
Aye.
Selectman Wilkinson?
Hang on one second. I think she remuted. Sarah?
Yep, aye.
Selectman Murphy?
Aye.
Selectman Brackett?
Aye.
Selectman George, aye. Thank you. Carries 5-0.
Thank you, Madam Chair. So we will have this ready to sign. The office will be reaching out to the selectmen tomorrow morning, needing to acquire 3 signatures at least to get this posted.
Great.
Madam Chair, do you wish to have the board take their stances on the articles now? Or do you want to do that before the board's executive session that it has coming up on Thursday?
I think we should do it maybe then, and so we can get to the schools.
Certainly. Thank you. That would be it, Madam Chair.
Okay. Our next is the schools for their presentation.
Okay, so let me just see. So I see Rob Lebo, Nicole Altieri. I see Jean Pratt. So Rob, is there anybody else that needs to be unmuted for this?
Yeah, Todd.
Todd, I think, was there.
Todd, okay. Todd, go ahead and unmute.
I believe that's the group.
Okay.
We didn't bring a actual presentation necessarily. I did have a school committee meeting last night where we presented an extensive PowerPoint that was the result of weeks and weeks of hard work by a 29-member school opening committee. And I believe that Mary Beth and Barb had put together a series of questions for you folks. But I think to sum up, the plans right now in schools across the state is to try to reopen in some format. The Commissioner of Education has asked schools to present 3 plans to him, and we have to give a rough version of that by Friday, and then a more flushed out version by August 10th. The 3 plans are a full opening plan, which they said to us was the desirable plan in their mind, that all students would return. And they had asked us to go out and start measuring classrooms, and that they had, I don't think the right word is discovered, but they were putting forth some new guidance with regard to social distancing and saying that 6 feet was preferred, but 3 foot could be the minimum. So that we were to go out and measure all of our spaces in the school to see whether we could put our enrollment into 3 foot spaces within the school. So we did that, and I'll get to our conclusion on that in a minute. The second model they asked us to do was what we did in the spring, a fully remote model, where school would not open and it would be in a virtual world, but they would ramp up the requirements. Instead of going credit, no credit, and not really much of an attendance and not holding people accountable if they didn't do the work as to whether they may move on to the next grade, which was the way the lay of the land was in the spring. They said your remote plan has to hold kids accountable, has to have grades, and has to be a fully educational piece, just like it would be as if the kids were in school. And then they said that you could present a model and should develop one for the hybrid. And what a hybrid is that you basically reduce the number of kids that come to school on any given day. So most of the models are you divide the kids right in half. You have an A cohort and a B cohort, and that they alternate in some way. And the plan that we're putting forward, which is our preferred plan, is to have a every other day cohort and then a fully remote day to end the week. We're doing a survey of staff right now, but that's out there as of last night. The other thing that I guess the reason why we have rejected the full opening model, which again was being pushed by DESE, was being pushed back by the Teachers Association, was being pushed by Betsy DeVos at the federal level, was being pushed by our president. But we have rejected the concept that we could possibly put all 800 kids back into those buildings and do that safely. And we have rejected the notion that 3 feet is a safe distance, because we feel that in the world of kids, 3 feet becomes 2.5 feet, becomes 2 feet, becomes, as a joke, I pull your mask off or whatever. And we're just not willing to put our kids through that or adults into that kind of situation. So what we're looking at is a hybrid situation in which there'll be 6 feet of social distancing and kids will alternate. It's not ideal, but it's the best model in terms of the safety of kids and also an educationally sound model, as opposed to trying to pull off fully remote learning is not a replacement for direct face-to-face learning. We discovered that last spring, and it's just very hard to do in lower grades. It's very hard to do in special education. It's very hard to do with kids that have a hard time focusing in regular school, let alone trying to get to the internet sources at home and actually being engaged. Transportation. They finally came out with regulations last week that say that school buses would have 1 child per seat, and you would then alternate inside of the seat, outside of the seat, inside, outside, all the way back through, that the windows would open, but would have to be open at least partially all the time. You would have sanitizing. The kids would be assigned seats. There would be a monitor on the bus, all buses, which is an added cost. And it would then reduce our capacity from around 70 kids down to 25. Even though if you had siblings, they said, well, if you've got a brother and sister, they can sit in the same bench seat. But if you're not related to each other, then you have to have this alternating situation. One of the things that sort of hit us hard last week was music, which is a flagship of our schools. We'd been planning for, well, how could we use the cafeteria? How could we use the auditorium and have this distancing and special kinds of things that collect the, lack of a better word, the spit from a brass instrument and all those kind of things. And Nathan Cohen had spent hours and hours doing that. But finally the guidance came out and said, no musical performances to be allowed inside. Everything must be held outside, and you must have 10 feet of distance, no exceptions. So we're sort of reeling from that particular mandate right now and trying to figure out how you would pull that off in the middle of December or January and have the kind of music program we would want to have. We do have to provide remote learning to parents who are uneasy with sending their kids back for legitimate reasons. We have to accommodate staff who, if they have compromised immune systems or are in risk groups, older folks, we have to be able to figure out how we deal with those folks and how we replace them if they can't be physically present with our kids. Our committees have done a tremendous amount of work. We have scurried around in the sort of black market world of buying PPEs, which, as you might imagine, there's price gouging going on everywhere. Masks that you might have bought for 50 cents are now $3 a piece. N95 masks are like gold in terms of getting those, and apparently there's a little stash hiding somewhere in Rockport, which we can have access to. We have established isolation rooms. That is one of the requirements for if a kid tests positive, to be able to get the kid to a separate isolated location. That sort of covers the major aspects. I would maybe defer to Mary Beth and Barb's list. We do have a request, and that has to do with the mask requirement, which right now the state says that masks are required from grade 2 and above for all students. They're required for all staff. but they say that kindergarten and grade 1 is highly recommended. And that puts us in a really tough bind with our adults that are in contact with those kids, with parents who want their children to have masks, and then they get into a situation where half the group that's in there is not having masks because it's recommended and not required. So we have been told we are allowed to go above the DESE recommendation and be able to capture ourselves underneath the requirement that everybody wears a mask. So we are going to ask you to, hopefully consider supporting us on that. We know it's difficult for young kids to wear masks. In kindergarten, and Todd can go into this, those rooms have their own outside doors so that kids could get out for very frequent mask breaks without having to, go through the entire building. And we just feel that that's a very important thing, to be able to allow our adults to come back and many of our kids to come back. And then if somebody says, well, just I don't want my kid wearing a mask, then if they don't have a medical excusal, then they could take on the remote option, because we are required to be able to educate any kid who is not able to attend school. So that's going to be a big ask coming up later on, is regarding the mask. But Barb and Mary Beth, I don't have the sheet open right now because obviously my screen's open, but maybe you guys could sort of go down that checklist a little bit for us.
So I guess, Barb, before you two begin, Rob, I just want to congratulate your entire team for its diligence and its really thoughtfulness around getting this really, really complex thing, set of issues together. So thanks a lot. And Barb and Mary Beth, I know you've got a really extensive list and that you'd like the Board of Health and I think the Board of Selectmen to comment on. If you could just highlight if there's any need for the Board of Health to have votes related to some of the specific requests, if you could highlight those in particular, that would be helpful.
Yeah, again, the mask one at the lower level is the flagship one. And again, I don't have the sheet open because I can't do both on my screen. So I would ask Mary Beth and Barb to run down the list maybe, and then I'll jump in when it's time.
Okay, why don't we turn it over to Barb?
Yep.
Barb, you're muted on your end.
You're muted, Barb.
All right, so this is intended to be a summary. The things that need to get talked about, we put in red at the bottom of our list. We would like an endorsement by the Board of Health for the 6-foot distance. We would like an endorsement for the masks to be K through 12 versus 2 through 12. And we need to have a discussion about masks versus face covering. So is there an endorsement for number 1 and number 2?
So
endorsement for distance and all grades with mask use or face covering use.
So I think let's go one at a time and let's have a discussion and have a formal motion. So
for each one?
Yes.
Okay. I move that we endorse a 6-foot distance between chairs in each classroom.
I second. Discussion, comments from other members of the Board of Health?
Just the comment that with the 6-foot distance would go in line with the hybrid opening model. And I believe the pressure testing concluded, Rob, that if we do the 6-foot, we would be looking at a definite hybrid reopening.
Comments from, I certainly endorse that. I was always very wary of DESE's option of 3 feet. I think it has an enormous downside. So thank you for adhering to what I think is a much safer guideline of 6 feet. That's my only comment.
My other comment is going to be that discussions we had with the school committee members on our board is that this will be reviewed. So maybe after the first quarter or the first semester, if our case numbers are really low, we could potentially choose something different. So this is going to be periodically reviewed by the school committee. Nicole, did you want to talk about that?
Yeah, I mean, we had just sort of, Michael and I had both, Michael Kelly, the chair, and I had both talked about the fact that what we decide now does not have to be for the entire school year, that we're very committed to periodically reviewing so we can be continuing to update and do what's best for the kids and the staff and the school. So whatever we decide now is what's best for now and will be reviewed.
So Mitch, I just had a technical question. Should we put timelines on the motions that we consider, or should we just make them open-ended? And then if we want to change at that point in time, we can revise the particular policy.
I would leave them, Mr. Chair, I would leave them open-ended. That way there's always something on the books until you change via another vote.
Thank you.
And to that point, sort of jumping the gun here, also last night at the school committee meeting, Nicole was appointed.
Mary Beth, I'm having trouble hearing you. Could you?
Sorry, let me go closer to the computer. Last night at the school, can you hear me better?
Yes, thanks.
Nicole Altieri was appointed as the Board of Health liaison to the school committee. So she'll be hopefully attending our meetings as we go into the fall. So congratulations. All these recommendations can be reviewed, you know, as the school committee. There's going to be a seamless line of communication.
Fantastic. So we have a motion on the floor and a second. Let's take a roll call vote. All those in favor of a 6-foot distancing between chairs in each classroom is the motion. Sid?
Yes.
Ron?
Yes.
Mary Beth?
Yes.
Barb?
Yes.
And I vote yes as well.
So I'm going to have to ask to be excused. The reason I've been distracted is that my mother's in the ED. So that's why I've been wanting to sort of move the discussion along. So I'm going to excuse myself to go do that, and the rest of you can discuss the rest of the list. Okay?
Thank you, Barb.
Sorry, Barb.
Good luck to Barb.
Good luck, Barb. Mary Beth, do you want to take us through the points of discussion?
So the second point of discussion would be to endorse a mask requirement for all grades K through 12. And for that discussion, if you can quickly have Todd Simendinger talk about, so what we're basically doing is we're making it more restrictive to say that kindergartners and first graders also would have to wear masks. And I would like Todd to quickly comment about that.
Yeah, I think for us, the biggest thing is that, you know, two points. One is that our highest risk population of teachers is in the first grade and kindergarten wings. And the second issue is the concern about, you know, the demographics of Rockport and the potential community spread that would come out of, you know, anything that was transmitted within the building and beyond. And, you know, and also having a policy that's really inconsistent across the building, where some kids are wearing them, some kids aren't, how you navigate that in a classroom with kids whose parents want them to wear a mask, but some kids don't. Legislating that is really not a practical matter from a teaching point of view. And the bottom line is we feel strongly that it's in the best interest of the safety of staff and students and the community as a whole.
Thank you.
To comment that worked into that, Todd, there are frequent mask breaks that are going to be required by DESE. Can you talk about that?
Yeah, so as Rob mentioned earlier, the kindergarten classrooms all have their own individual exits, exterior exits, which makes it a little bit easier for them to be able to just walk right outside the classroom for mask breaks. And the first grade classrooms have an exterior door that's right next to their classroom. So we would be looking to build in very frequent mask breaks right out of the gate, and then potentially as kids became accustomed to them, reducing those breaks as they adjust to the mask requirement. So in truth, I've talked to a number of kindergarten parents who already have their kids wearing masks and don't seem to have a lot of concern. I have first grade twins, and it's a little bit of a struggle, but they've adapted. So I think that they'll adapt relatively quickly to the masks.
Thanks, Todd. Any comments from Board of Health members? So I move that the Board of Health endorses the requirement of face coverings or masks for all grades. Do I hear a second?
I'll second.
Okay, let's have a vote. Ron?
Yes.
Mary Beth?
Yes.
Sid?
Yes.
And I vote yes as well. So on a vote of 4-0, the Board of Health endorses that. Mary Beth, you want to take us through the next several items?
Yep, the next point of discussion would be masks versus face coverings. So there's some discussion with the group and whether sort of a handkerchief that kids can wear versus a mask that sort of loops around the ears is tighter to the face. And I don't really know of any studies that saying one is better than the other or not. So it might not be something we want to decide on right now, but the school committee and the opening committee was looking for some recommendations on which the Board of Health would prefer.
So my initial comment, I haven't seen any studies per se, although there have been evaluations of face coverings and homemade masks in terms of thickness, et cetera, et cetera. My bottom line is for kids, whatever they're used to and is easiest for them to wear, because compliance is going to be the major concern as far as I think. So I would say whatever is most comfortable for the kids, and which increases the probability of them wearing their face coverings, is what I would suggest. I'd like to hear opinions from the rest of the board. Ron?
I did see somewhere that bandanas were not as effective as masks. You know, if they're open at the bottom and loosely tied like they're holding up the stagecoach, you know, that's not as effective. I mean, it may be that if that's the only thing a kid could tolerate, you may have to, you know, it may have to be good enough. But I would suggest that the preference be something that's tighter to the face. But whether it's a homemade cloth thing or not, I think as long as it's close to the face, that would be preferred.
Great point. Sid, any thoughts?
Yeah, I think either a face mask or a regular mask, whatever you can get the kids to wear, whether it's using their imagination or whatnot, more effective than something hanging off their chin. So either one.
So the general sense there is a preference for a mask, but any face covering that works for the kids is acceptable. And Nicole, comments?
I was just wondering if we could hear, I know that I'm kind of the person that brought up the concern in the committee, because I think some of the concern was if you don't specify, you'll have kids coming in with t-shirts tied across their face, or kids that think it's funny to, you know, put a pair of shorts over their head. And I was wondering if we could hear from Jeannie Pratt, who's our district nurse leader, and kind of get her sense of that.
I agree with you, definitely. I think we need a mask. We do have children with hearing impaired that do have hearing aids, so we'll need to make an exception for that, but I am all for the masks, definitely. I'd like to hear other people's comments too.
Dr. Cohen, can I make a comment? Would that be okay?
Sure, I'm sorry. we welcome comments from the Board of Selectmen as well.
Thank you. I'm just curious if there's a way to standardize what goes on, because I would imagine that some masks would be more effective than other face coverings, and other face coverings might be more effective than some masks. So, you know, I don't know if there's a way that if it's feasible to issue, if it's something that is required that we would supply, or that perhaps parents would be required to buy as part of the school kits that they get every year. But I just think that if you have a mask that, you know, again, you may have and I use the term loosely, bandana, that's better than some of the masks that are out there, because you can buy a mask anywhere online now. I mean, Old Navy sell them. Anybody can buy them, but that doesn't mean that they're effective. So I don't know if the quality is what we're really concentrating on, or just the type is what we should be looking at.
It sounds like we're looking at the type, just to make sure that folks are wearing, kids are wearing masks. I don't know if we want to get into, you know, the type of mask, just as long as the kids are wearing masks.
I agree.
And as it stands now, I think that the school and DESE expects that parents will be providing masks for their kids. And they expect that they will have more than a couple masks, because they're going to need to be cleaned. So there is some talk about maybe the Ed Foundation or the PTO providing emergency masks that maybe families can purchase. And we do have a supply, our PPE supply is good for like sort of emergency masks. So when we tell parents that, yes, you will be providing masks for your children, perhaps if we say a tight fitting mask is preferred, I think that might do it. And then we'll see what we get. You know, if we have kids with just, you know, a bandana that goes just here, then we'll just sort of have to deal with those on a case-by-case basis.
I just know, being 30 years in public education, we are going to have to, the school department and every other public school across the Commonwealth are going to have to provide some masks, because kids are going to arrive to that school without masks. So if we're going to take this, you know, position, you know, having the mask, which I think is a good thing, the school department and the town are going to have to provide backup masks.
The school department.
Mary Beth, I'm sorry, Rob, is the DESE guidance, does that specify masks, or does it say masks or face coverings?
I'd have to pull it up. I think it says masks or face coverings, but I don't want to swear to that without pulling up the document. We have bought multiple, even in the thousands of masks. And that is to take us, DESE had recommended a 3-month supply. And what we used was, no, this will be over in 3 months. We're going to get at least a supply. And that was if we were going to go back fully with all of our kids. That took us beyond February vacation, because we figured even if there was a vaccine, that we'd, you know, be well into February vacation before there was anything going on. And we didn't want to get into a 3-month supply and then you couldn't order any. So we will have more than enough masks for any kid whose family cannot provide masks, and also for staff. The face covering part, I do agree with the compliance part, depending on, you know, who that kid is, making sure they have it on. I mean, I have one on right now that is a ski thing. I mean, it's not your regular mask. Ingrid got it for me, but it's much more comfortable to wear, especially if you're saying for 6 hours a day, you're going to have a middle school kid with a mask on, and then they're going to pass in the hallway, and you don't want them to be dropping the thing and hanging it off their ear, that if it's fully around their head, it's more likely to stay on them than when they pass in the hallway and they drop it and there's no monitor there and they laugh at each other or whatever, and they create aerosols in the hallway passage at middle school or high school. The elementary kids are going to be contained pretty well. The middle school and high school kids are going to do what middle school and high school kids do. They're going to go to 5-6 classes a day. They're going to have passing times in hallways that they wish you would have be one-way hallways. But if you've been in the high school, figure out how do you do one way and get to locations you have to get to. There are places where you're going to have an interstate median in a sense, and have kids passing up against sort of the locker areas, but separated by 6 feet. You want those kids with something on their faces. And I'm just worried that if you've had it on for 3 hours already, and now you got 5 minutes to get to your next class, that I can see a lot of them dangling from the left and right ears. And that's not what we want to have. We want to have kids with that on there and be able to say, pull it up, you know, when you see a kid. And it's much easier to do that with a face covering. Now, I'm not sure exactly what will be popular and what will be cool. I think we'll have a little bit of that going on because that's the nature of school. But I think a good face covering that is fully attached to the face and you know, covers nose and mouth fully is what we want to have for our bullseye, and not, in my opinion, go to just the mask, because I think we'll have a lot of non-compliance, and then we've got a lot of disciplinary issues. And what do you do with the kid that won't wear a mask? I mean, I think the answer is you send them home. They go remote. They can't be there, obviously. Yeah. But if you're doing that over and over and over again, where you could have had a kid with a well-fitting facial covering who would have stayed with you, that to me is more of the outcome you want to have in terms of reducing the potential for aerosols and those sort of things. Knowing the sort of reality of schools after 40 years and having been an assistant principal and knowing, you know, how you keep kids from throwing food at each other in cafeterias, that, you know, kids are going to be kids still, and they're going to be more anxious, more nervous, more upset, and the level of sort of activity, I think we're going to see more of that. We're going to see more mental kind of situations. We want the kids to come back and be comfortable. You know, they're only going to have half their friends there. It's going to be awkward for them. And I understand the sort of the mask being there, but wear it for 6 hours. You know, in the middle of September in a building without very good ventilation on the second floor where it's 95 degrees, and decide whether the compliance is going to be where you want it to be if you say all masks.
And I think we need to adhere to the state and all these recommendations to make sure we keep our kids compliant. I mean, it's not comfortable for any of us.
Yeah,
I mean, but
the state, and just to answer the question, that I did find it in the DESE guidelines, and DESE does said masks or face coverings.
Okay.
Ruth? So maybe we need to say something about face coverings that, like Mary Beth said, are close to the face or something, because using a buff that goes up and down, even though I feel like that involves a lot of touching up near the face, but is different than wearing, you know, I don't know.
I agree. I think it would be important to describe what we want the item to do, which is clearly cover the nose and the mouth, snug to the chin, and fully cover, you know, fully cover the nostrils, and make it clear in communications with the parents, this is the face covering that their kids need to be wearing. And we can, you know, express a preference for masks, but I certainly would resist the notion of requiring masks, because I think, again, that's going to defeat the ultimate goal. That's my opinion, not based on epidemiologic fact. Ruth, please.
Yeah, I was just going to say, I mean, they're kids. You got to give them a couple of options, and you know, you also have to take in consideration what these kids have been using for the last 5 to 6 months. What are they accustomed to? I mean, a lot of these kids are used to wearing things all the time, and whatever's comfortable for them and they are wearing well, we should try to encourage, and whether that be a face covering or it be a mask, but we should give them strict guidelines of which one it's going to be. You know, they can mix or match, but it's one of these, and whatever they're comfortable with, I think is the biggest thing, especially we're going to have windows open, good ventilation.
I think you have a sense of opinions from the boards. Anyone else want to comment on this before we move on?
How are we moving forward from this?
I don't,
It didn't necessarily need an action. I just think that the opening committee and Nicole in the school committee was looking for an opinion from the board. And I think, have you gotten that?
And I think describing it, I think what Bruce said is like, we don't have to say it has to be a mask, it has to be this, but something where we're at least describing the areas of the face you want it to cover, because my son's going to be a freshman in high school and most of the kids his age I see have something sort of maybe tied up here that maybe hits down here and they're hanging at, so maybe you want to describe where you.
And I totally get that. Believe me, I worked in high schools all my life, but I just worry about the ambiguity of, I do worry about that, but let's keep going.
yeah, and as we said, if this is not working, we can always,
Indeed.
as long as we're compliant with the minimal DESI guidelines, we can change. So let's.
Yes, agreed.
Face shields with chin covering for teachers while teaching.
So this was another item that was brought to us by the teachers, where teachers were going to wear a sort of a face shield that then sort of was closed at the bottom. I wish Barb was here because she was going to get Lucas Wolf to sort of weigh in on these for teachers who, maybe had to do speech class or something where their mouth had to be seen. So teachers were asking about the appropriateness of wearing something like that. Patient masks were not very easily found. The clear ones, they were having a hard time finding those. I don't know if we should wait on this until we can get Barb's reading from Dr. Wolf.
Let's see if we have a couple quick comments and then we can revisit it at our meeting in 2 weeks. Sid, did you?
Well, I think the face shield is appropriate if you're in the hospital and you're intubating people. As far as the general wheel of things, I don't know that that makes any advantage to the individual or the people around them, save for it. Now you got another thing that's going to fog up, make it more difficult to be comfortable in it. So I think the face shields are the school is the wrong environment to be thinking about face shields.
I have a slightly different opinion. I think for many kids, being able to see the teacher's mouth will be really beneficial for learning, particularly younger kids. The question is, how valuable are face shields for protecting the spread of the virus? And I think the notion of face shields with some kind of chin covering will, reduce potential aerosolized and droplet spread. So I would encourage exploring those possibilities if it really helps in situations for teachers. So I don't see any particular problem with that if at all possible. I looked at some of the literature, and frankly, the literature was all over the place. Some folks said it's fine because heavy droplets will drop to the ground, and the emerging literature says fomite spread is increasingly rare. And others said, no, it's not an effective way to stop viral spread. So I don't think there's any consensus in terms of the research of how effective face shields are, but face shields with chin coverings seem to be potentially appropriate, in my opinion. Any other Board of Health members want to weigh in on that?
Yeah, I agree with you. With the reading I've done, it supports what you've said, Bruce. I couldn't get a sense of that it's been compared with face coverings in terms of effectiveness. the purpose in this case is to protect other people from the teacher speaking, as opposed to the hospital where it's to protect the medical professional from the patient. So the purpose in the classroom is somewhat different. But I think if our infectious disease person weighs in and feels that it's reasonable for the nurse, for the teachers, that I think if they're more comfortable with them, I think it would be appropriate myself.
Great. Let's move on.
Just a tangential to that. The idea of trying to communicate to someone through a mask is sometimes difficult. Will any of the teachers have a microphone that they can carry around to be able to overcome that obstacle if some of the kids have a hard time hearing them? We use them in town meeting.
Well, I know I can speak from being working in schools and so forth, but we have kids that are hearing impaired, and some teachers have to work with microphones, and the student would have the other end on their ear and so forth. So that happens, but I to say that they're going to do for 30 kids in the classroom or 20 kids, I don't think that's going to happen.
You could have just a microphone?
Yeah.
Yeah, I know Bob Allier, currently, he has always used one of those just because he's a soft talker. And so he has it as sort of like, it's attached to the speaker and it sort of, you know, projects out. But I don't know that any of the teachers have talked about needing something like that. It hasn't really come up.
So maybe that could be part of a discussion moving forward about the possibility of having, you know, if particular classes of particular teachers would need any vocal augmentation, to consider using microphones for those wearing masks. I think it's worth thinking about.
With the younger kids, one of the big issues we have, you know, when you're learning to read, can you see the teacher's lips? So there are masks that are available that have a clear panel across here, but those are like trying to get gold as well right now. You can get the regular masks, you can't get the ones with the clear panels. But we would certainly be able to provide microphone assist wherever was necessary.
Great. Next item, the DESI exposure definition versus everybody else's.
Yeah. So this is another one I wish Barb was here for. And this is something that I would like some comments from maybe our public health nurses. So there's been a lot of questions from teachers and parents about what exactly an exposure is. So if a student is in a classroom and comes back positive, would everybody in that classroom need to quarantine and be tested? If a parent of a student becomes positive, and a child is then exposed, does that mean the rest of the classroom is exposed? So there's a lot of questions regarding what would we consider an exposure if kids are all wearing masks and are 6 feet apart?
Yeah, Mary Beth, did you see it just came out really late. I think I sent it to the entire opening group, which was the protocols that schools would use for all the kinds of things you're talking about, which came from DESI, that Barb had a copy with, which I believe is CDC related. It's like 20 pages long and has all the little flow charts. You're in a classroom, kid tests positive, parent, and this is what you do and how long they have to be out. So I think that, at least from the school's perspective, they have issued their directives to us about how that would be handled. If for some reason you didn't get that yet, I can forward that to you, but it's quite a lengthy document and goes through almost all scenarios.
I think, you know, I'm really glad, Nicole, that you're going to be coming to our Board of Health meetings. And I know, you know, whatever happens tonight is certainly not the final word. This is going to be ongoing conversations, you know, through the opening and continuing thereafter. So let's postpone this discussion until we've all had a chance to review this material. Is that all right, Rob?
Yeah, one other thing, and it just was approved last night. We approved our school calendar, and there was a negotiation going on between the Maine Teachers Association and the Department of Education about when to allow kids to return to school. And apparently the Teachers Association were actually asking for 30 days before kids would return versus their normal opening date. The commissioner had been offering 5 additional professional days for training and, getting used to all the remote models and how to deal with the PPEs and stuff like that. They finally settled on giving all school districts in the state of Massachusetts 10 additional days, reducing the instructional requirement of the year from 180 days down to 170 student days, have the same number of teacher days. And for us, our school year will start on September 16th and not last week in August, which is where it would have started. And there will be 10 total professional development days, because we normally had 2, that will be involved in bringing in bus drivers, custodians, all the food service people, all of our teachers for intensive professional development on the safety aspects of dealing with COVID, on the protocols, as well as how do you do remote properly? How do you do the hybrid model properly? And Paul's school is going to be doing the same thing. I don't know if they, bid on the 10 days or not, but that just came off the press yesterday afternoon. And that does buy us a little time. And, things could change between now and then. Everything we're talking about tonight may be totally different depending on the dynamics of things. The Massachusetts Teachers Association are still pushing for some pretty tough things, like certify your building is environmentally safe for kids.
Yep.
Well, how do you do that?
And teachers.
Right. Is there a special certification group that comes around and says, your building ventilation is lousy, even though we're checking it all, that it may be a rock thrown in front of us that could cause us to be all remote again? There have some pretty high demands out there as a union for their adults and their members who rightly are worried about going back to school, and even in a hybrid, being in a situation where they're not convinced that some of the regulations have been made in their best interest. So, stay tuned, I guess, to see what's going to go on. They have a meeting tomorrow with all of their membership in the entire state. So 5,000 people had already registered, and which is where they'll process, do you feel comfortable going back? Do you not feel comfortable going back? What would you like us to do as a union? And it's a pretty powerful union. So a lot of the things that are going on here, may be a little bit for us. And at least we have some time.
I would like to just say one quick comment, and it's not for discussion tonight, but I would like to say that Teresa and I have, and many public health people have read through those protocols. And there is guidance from DESE about exposures to confirmed cases of COVID that's in direct conflict with the way we do case investigation and issue quarantine orders. So we continue to ask these questions on our DPH calls, but there's a direct conflict between the two that we need to seek some clarification on. So for another conversation.
So on the DPH call,
or you're a principal coming back into a building with conflicting information coming at you in multiple directions worries you. And that's all I can say is stay tuned for what reality may be.
hopefully there'll be more clarity in the future. I don't know, Chassie, whether you were on the DPH call today that specifically addressed this issue. And my sense was DPH reluctantly deferred to the DESE guidelines because that's the state law.
And truly, it puts us in a very difficult position, because if there is a child that attends Rockport schools who's had exposure either in the school or outside of the school to a known COVID case, Teresa and I would be contacting that family and saying, you must be in quarantine for 14 days. And the DESE guidance says that the child can go back to school with a negative test. But that doesn't fit with isolation and
That's right.
quarantine
So
protocol. So we
if
just,
if the initial event happens at school, then it ends up being different than if it happens in the community. So again, it's this is a conflict of state agencies that I don't know will be resolved, but certainly my sense is all of the local boards of health on the call were very upset about the DESI guidelines as being inconsistent with good public health practice. And that's, I mean, Sid?
Yeah, just to give me something to worry about in the middle of the night, you pointed out that the prevalence in Rockport right now is 1.4. Now, Rob's got 800 kids he's going to send to school. If he sends 400 of those to school every other day, you got 6 kids at any one time who are positive for COVID and have no symptoms. All the time, if you run the numbers. Now, hopefully we're saying the distancing, the masks, the washing your hands and lighting votive candles is going to help. But the background is this is being laid upon a stealth infection in the school, which is there every day, every time.
I can't disagree with you, Dr. Wedmore. I think you stated that effectively. And that's why reopening schools is fraught with enormous concerns. We don't really know what the true infection rate is among kids, but we have a better sense of what it is among adults. If you just look at the number of adults who are going to be at schools, one can predict there are pre-symptomatic or asymptomatic folks, adults in those schools. So that's why we're trying, I think, to manage the best we can.
For a future time, Bruce, in a better world, we should be able to take all of the kids in one class, batch test them on Friday, and have the results back on Monday. Do the same thing with every teacher and know who can go to school the next Monday and who has to be plucked out of the general population. We don't have the money for that. We don't have a lot of things, but until we have a vaccine, that's where we've got to go.
One question, and then I'll open up for final discussion. This is pretty long meeting. Some hybrid models are 2 weeks on, 2 weeks off. And from an epidemiologic point of view, in terms of exposure and then quarantine, at some level, theoretically, that makes more sense to me, but I don't know how that affects parent and family and teacher schedules. It might reduce the amount of cleaning needed between the cohorts at school. I wonder whether that was, ever thought about, Rob.
Yeah, the only model that I had heard about was one that was being put forth by the commissioner, which was his preferred model, 1 week on, 1 week off, but not a 2 weeks on, 2 weeks off. The concern is that you take kids away, for 2 weeks and you put them in a remote learning environment. A teacher cannot teach both live and remote at the same time. You can't expect them to do that. So those kids that are home on an every other day at least get here's what to work on tomorrow, watch this tape or whatever, and I'm going to see you on Wednesday. And we have the ability to be in our building. We bought 4 of those sanitizing misting machines that spray a room down in 3 minutes and make it safe for return the next day. And the building is going to be sanitized with those machines. The town has access to those. And educationally, having kids be out for 2 weeks would be a disaster in my mind. And people have mostly rejected the 1 week on, 1 week off as well. And that the model that's out there now, there's a little bit of debate over where should the days be? Should you go 2 days and then 2 days? We have a survey out right now that's, well, actually going to go out tomorrow morning because it's has to be put together. It's going to try to get faculty feedback on how they feel about our proposed model, which right now is a cohort A Monday, Wednesday, cohort B Tuesday, Thursday, all kids remote on Friday, and then you can do cleaning of the building not only during those initial parts, but you have a much greater day with no kids in the building at all on Friday, and that you have more continuity that way. Paul's school district's probably doing something different or similar. There are a lot of places doing a hybrid, much like ours, with a little bit of structural differences possible. But I haven't heard any doing the 2 weeks or even the week on, week off models that I've heard of that are close by.
Thanks for that explanation. Mary
There are
Beth,
some trying to put the elementary schools fully back, to be honest with you, because there's a real childcare issue. We're beginning to hear from parents about, you know, we both work and you're going to have my second grader home on Tuesdays and Thursdays. I can't, how do I do that? So there's some really, really tough situations out there right now, no matter which model you go to or what you do.
Mary Beth, is there anything else that we that you'd like input from the Board of Health on tonight? I know this will be an ongoing conversation.
Yeah, there'll be many things that we'll be coming to the board with, but one last one to just quickly get a quick approval of is Barb was nice enough to go through the school with Kurt, look at all the facilities, all the classroom, and she did make some recommendations. And I know it's going to take some time for the janitors to do this, but her recommendations was that all cloth furniture be moved from classrooms so that the classrooms can be easily sanitized, and it'll just help with disinfection. So if we could just act on that and so that they can get underway with that, that's going to take some time.
And that's well underway, just so you know, Mary Beth, because right now the custodians are in there, empty all the rooms out and clean them, deals. And when you put the desk back in and need to do 6 foot of distance, you can't have, you know, a file cabinet, even you can't have your chair and your plants and all that kind of stuff. That's all been told that to teachers that's going in storage, that they need to get that stuff out. Have a clear statement from you folks would also help add a little power to that.
The more decluttering of classrooms and the more bare bones, the greater the reduction in potential risk is. So I would certainly endorse all of those efforts. Would you like a Board of Health motion to support that?
Rob, do you think that it's needed?
Yeah, I think that will be helpful for the person that says, well, no, I love the kids to read in this comfy chair I have them in the corner, there's enough room for it. But it's a comfy chair that isn't easily sanitized. I'd much rather have the ability to say, I mean, not pass the buck to you guys and say Board of Health says, but to have the support that that's not a safe kind of situation, that, you know, more than just the school people have said, get that stuff out, I think will help us.
Well, backup.
So do I hear, Mary Beth, do you want to come up with a motion?
Okay, so I move that the Board of Health directs the school to remove all cloth furniture. And can we say, what else can we say? And unnecessary decorations from classrooms for the beginning of the school year until it's safe to put it back.
I second. Any additional discussion?
Well, decorations, does that mean things come off the walls?
Yeah.
Is that what the school wants? Would that be helpful?
That was Barb's suggestion, actually.
I mean, I think it's gonna be an awfully sterile school without things on the walls. I mean,
Well, if you wanted to start and just start with just the cloth furniture, we can start there.
I would actually, if it would be considered a friendly amendment, and declutter to the greatest extent possible.
mhm. Yeah.
I think that sends the message that, you know, the classrooms should be as easily disinfectable as possible.
I second that.
Let's have a vote. Oh, Sid?
Yeah. What's the premise that a cloth furniture is more of a risk than a wooden piece of furniture, knowing that fomites provide very small means of transmission here? Now, I think you can do all of these, but this is starting to sound like back in the 80s when they told patients that you couldn't bring flowers to your relatives in ICU because they absorb too much oxygen. And I'll just end it on that.
I guess what's generally, if you look at the lodging guidelines where people are removing magazines and, you know, a bunch of extraneous stuff in lobbies and things like that, there's a general sense, even though you're right, fomite transmission clearly is not a major source of transmission, why, you know, why even have that as a potential source? So however, I think it's easiest to disinfect and keep things clean, the more supportive we can be, I think the more helpful and ultimately in reducing transmission we could, you know, can occur. So I understand it's at the margins, but I think it's worth considering if it doesn't impede school functioning at all. So, any other comments? We have a motion and a second. Ron?
Aye.
Mary Beth?
Yes.
Sid?
No.
And I say yes. On a vote of 3-1, the motion carries. Is there any final thing anybody from the school community wishes of us for this evening? Thank you. Where are we in the agenda?
Number O. Next. 3 hours and going. Okay. Number O, Board of Selectmen and Board of Health update. Let's start with Board of Health. Is there any updates that we need to talk about from the Board of Health? I mean, Board of Selectmen. Ross, anything?
Nope.
Dawn, anything?
I'm good for now, Ruthie. Thank you.
Paul?
I'm good. Thank you, Madam Chair.
Sarah?
Nope, I'm good, thank you.
Mitch?
All set, Madam Chair, thank you.
Board of Health? Bruce?
No.
Dr. Wedmore?
Nope.
Mary Beth?
No.
Dr. Newman? Okay. P, Health Agent, Health Inspector, and Health Nurse update. Let's start with the health nurses.
There's head shaking, Madam Chair, so it's a no for the nurses. Leslie?
Health Inspector? And
I
Health Agent.
I have one quick thing. In the board members' packets is the bills authorization form, which we need signed annually. And if people can sign the PDF and email it back or something else, we'll follow up with an email. But if people could just know that we're going to need the board members to sign that.
Could you send that in a separate email again, Leslie? It'll be easier to find.
Yep.
Thanks.
Yes, Dr. Wedmore, do you have a question?
Why can't this be done electronically in office? I mean, we know the intent of it. We know they're all going to sign it. And isn't that something just Deb Powers can do, authorized by us to do? That's for Mitch.
So, yes, for the time being, I think if you take a vote right now that you give that authorization, the chair can sign with the understanding that it was by vote of the board, and that would suffice for now.
I'd like to make that motion then.
And I'm happy to second. So Leslie, you'll send me something to sign and send to Deb. Yes?
Yes, thank you.
Let's have a vote. Ron?
Yes.
Sid?
Mercifully, yes.
Mary Beth?
Yes.
And I vote yes as well. 4-0.
Okay, Q, public comment.
I just want to see, John, do you have any updates?
He shook his head no.
Oh, okay, thank you.
Okay, public comment. Mitch, can you open up the mics and see what we have for comments?
Sure. So if anybody wishes to speak during public comment, please use the hand raise function or please raise your hand in your video. We have no one on the phone line, so it's down to just those on the video. Please either raise your hand or please use the hand raise function. Madam Chair, seeing none.
Okay. Any from the boards? Board of Selectmen of no further comments. Okay. Do I have a motion to adjourn?
I'm sorry, Madam Chair, one quick item. Our next Board of Health meeting is scheduled for Thursday, October 13th at 6 p.m.
August.
Oh, yes, August. Oh, what did I say?
October.
Bruce, we'll all be there for October. Don't worry about it.
I got it in the book.
August 13th, Thursday at 6 p.m. We've scheduled our next meeting, and we'll discuss other meeting schedules moving forward on that date. Thank you.
Great. Okay, hearing no other business, do I have a motion to adjourn?
So moved.
Seconded.
Second.
Roll call vote. Selectman Campbell?
Aye.
Selectman Wilkinson? I think she's gone off the thing. Okay, Selectman Brackett?
Aye, sorry.
Oh, sorry. Okay, thank you. Ross said aye. And Selectman George, aye. Dr. Cohen?
Yes.
Dr. Newman?
Yes.
Dr. Wedmore?
Yes.
Mary Beth?
Yes.
Okay, thank you. Thank you to the school committee for that great update. They did a great job.